ਹੋਇਆ ਪਿਆ ਕਰੋਨਾ ਸ਼ੁਰੂ ਹੋ ਗਿਆ ਇੱਥੇ
ਰਜਿਸਟ੍ਰੇਸ਼ਨ ਇੱਧਰ
छोड़ ले सारे
Good morning, everyone. Our dignitaries will be here within 2-3 minutes, so kindly stand up for their respect when they came here. kindly stand up. And give a huge round of applause for our dignitaries.
जिंदगी की असली उड़ान अभी बाकी है, जिंदगी के कई इम्तिहान अभी बाकी है, जिंदगी की असली उड़ान अभी बाकी है, जिंदगी के कई इम्तिहान अभी बाकी है। अभी तो थामी है मुट्ठी भर ज़मीं हमने, अभी तो थामी है मुट्ठी भर ज़मीं हमने, अभी तो थामना पूरा आसमां बाकी है, अभी तो थामना पूरा आसमां बाकी है। A very good morning to all of you, the galaxy of intellectuals, Your Excellency, invited speakers, trustee members, teachers, and all my dear friends. I, Diya, with my co-host Komalpreet, students of BSc Radiology and Imaging Technology, Guru Nanak Paramedical College, Dhahan Kaleran. It gives us immense pleasure to extend you a very warm welcome on the behalf of entire management of Guru Nanak Mission Medical and Educational Trust, Dhahan Kaleran, and staff members of Guru Nanak Paramedical College, Dhahan. Our Honorable President Sir, Mr. Hardev Singh Kama, our General Secretary, Mr. Kulvinder Singh Taha, Director, Dr. Shivinder Singh Gill, and Convener, Mr. Varinder Singh Barar. Vice Principal, College of Nursing, Ms. Ramandeep Kaur, Director, Guru Nanak Mission Public Senior Secondary School, Dr. Harban Singh Bolina, and we welcome our eminent speakers and all faculty members from different universities present over here.
Now, we will have our traditional auspicious lamp lighting ceremony to praise Almighty God. And I would like to invite our Honorable President Sir, Mr. Hardev Singh Kama. Yes. General Secretary, Mr. Kulvinder Singh Taha, Director Sir, Dr. Shivinder Singh Gill, yes, Chairman Finance, Sardar Amarjit Singh Kaler, Director of Guru Nanak Mission Public Senior Secondary School, Dhahan Kaleran, Dr. Harban Singh Bolina, Convener, Mr. Varinder Singh Barar, and our mentor, Mr. Razib Thedbar. Thank you everyone for joining us on the stage. Give a huge round of applause. Vice Principal, College of Nursing, Ms. Ramandeep Kaur. Thank you so much, everyone. Additionally, it is our culture to remember God Almighty before everything we do or start. So let's begin the event seeking the blessing of God. Now, I would like to call our students of Guru Nanak Paramedical College to recite the prayer in front of you. So please kindly join us.
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ ਦੇਹ शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो देह शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो शुभ कर मन ते कबहू न डरो और सो जब जाए लरो निश्चय कर अपनी जीत करो देह शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो शुभ कर मन ते कबहू न डरो अर सिख हो अपने ही मन को ऐ लालच हो गुण ताऊ चरो देह शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो शुभ कर मन ते कबहू न डरो जब आव की औध निधान बने अत ही रण में तब जूझ मरो देह शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो देह शिवावर मोहे हैं शुभ कर मन ते कबहू न डरो 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 बोले सोनिहार सत श्री अकाल वाहिगुरू जी का खालसा वाहिगुरू जी की फतेह
Thank you all for creating a heavenly atmosphere here. We feel very privileged today to facilitate our guests and speakers. We would like to invite on the stage our Honorable President Sir, Sardar Hardev Singh Kama, General Secretary Sardar Kulvinder Singh Taha, Director Sir Dr. Shivinder Singh Gill, Chairman Finance Mr. Amarjit Singh Kaler, Director of Guru Nanak Mission Public Senior Secondary School, Dhahan Kaleran, Dr. Harbans Singh Bolena, Convener of this event, Mr. Virender Singh Barar, Vice Principal Guru Nanak College of Nursing, Ms. Ramandeep Kaur. And our mentor, Mr. Rajdeep Thedwar, sir.
मायूस मत होना जिंदगी से, किसी भी वक्त तेरा नाम बन सकता है। मायूस मत होना जिंदगी से, किसी भी वक्त तेरा नाम बन सकता है। अगर दिल में हो आग, अगर दिल में हो आग और हौसले हो बुलंद, तो अखबार भेजने वाला भी कलाम बन सकता है। Now I would like to invite Dr. Vikas Tiwari, Professor Medical Laboratory Technology, Organised Institution of Paramedical and Allied Sciences, Rudki, Uttarakhand. Well, I request President and General Secretary Sir kindly facilitate our guest speaker and give a huge round of applause for our guest speaker. Thank you so much, sir. Well, I would like to invite Dr. Jayashree Karanwal Tiwari, Professor Physiotherapy, Organised Institution of Paramedical and Allied Sciences, Rudki, Uttarakhand. So I request Director and Chairman Finance to facilitate our guest speaker. Give a huge round of applause for our guest speaker. Thank you so much, ma'am. Well, I would like to invite Dr. Saurabh Gupta, Assistant Professor Medical Microbiology at Mata Gujri College, Fatehgarh Sahib. Well, I request Mr. Amarjeet Singh Kaleran and Dr. Harban Singh Bolina kindly facilitate our eminent guest speaker. Give a huge round of applause for our guest speaker. Thank you, sir.
Now, I would like to invite Ms. Bhavna Solanki, Research Scholar, Department of Radiology and Imaging Technology, Assistant Professor, Santosh Medical College, Ghaziabad, Uttar Pradesh. Give a huge round of applause for our guest speaker. Thank you, ma'am. Well, I would like to invite Ms. Piyushi Yadav, a research scholar, Assistant Professor, Department of Radiology and Imaging Technology, Sant Baba Park Singh University, Jalandhar, Punjab. Give a huge round of applause for our guest speaker. Thank you, ma'am. I would like to invite Dr. Abdul Wajid Bhatt, Assistant Professor, Department of Radiology and Imaging Technology, GNA University, Fagwara, Punjab. So give a huge round of applause for our guest speaker. Thank you, sir. Now I request all the dignitaries to take their seats. Thank you everyone for joining us on the stage. So give a huge round of applause for all the dignitaries.
Thank you so much, everyone. Proceeding with the event, I would like to invite the sculptor of individual personality, a wetness scholar, and a navigator of a flagship of knowledge, our Honorable Mr. Hardev Singh Kama, to present a concise agenda of this event. Huge round of applause for Mr. Hardev Singh Kama.
Thank you very much. Ladies and gentlemen, and our distinguished guests, which have come all the way from different places and from the different colleges, our worthy Dr. S.S. Gill, ex-Vice Chancellor, Baba Farid University, Faridkot, Dr. Sarup Gupta, Dr. Vikas Tiwari, Dr. Jashin Tiwari, Madam Bhavna Solanki, Mrs. Piyush Yadav, Mr. Abdul Wazid Bhatt, and of course my colleague, a member of our trust, Sir Amarjeet Singh, Sir Kulwinder Singh, and the Vice Principal of our Nursing College, Madam Ramanjeet. I think, are you okay with Punjabi if in case I want to speak in Punjabi, because then I can come out myself nicely. बड़ी खुशी की गल है that we are proud that we are organizing the first paramedic convention in our campus with the complete, I should say, हम साढ़े जेडे पैरामेडिकल कॉलेज के फैकल्टी है उन्होंने बड़ा अच्छा काम किया. ऑफ कोर्स मिस्टर ब्राड और प्रिंसीपल और अपने साढ़े होर जिन्ने भी बंदे आ इस इवेंट नू सक्सैसफुल बनाने लिए बड़ी मेहनत की और मैं महसूस कर रहा कि ये जी मेहनत है जरूर रंग लैके आएगी. मेरे तो पहला साढ़े पैरामेडिकल कॉलेज की कुड़ी ने बड़ा वधिया शेर पढ़िया. उन्हें कहा कि सफा जमीन तो असी लुट ली आ, असी आसमान भी लुटना. बहुत वधिया गल है. मेरे को बच्चों स्टूडेंट्स एको ही शेर याद है मैनू, वही मैं पढ़ दिना होना बार बार पाया कि मेरी ज़िंदगी भी एक मुसलसल सफ़र है, मेरी ज़िंदगी भी एक मुसलसल सफ़र है, मंजिल पे पहुँचे और मंजिल और आगे बढ़ा दी. मंजिल कभी ख़त्म नहीं होंदियां, मंजिल और भी होंगी और भी होंगी, बहुत मंजिल होनियां. अगर आपके हौसला होवे, अपने विच कुछ कॉन्फिडेंस होवे, और ये हौसला और कॉन्फिडेंस कित्थों मिलदा? ये थोड़ी एजुकेशन तो, थोड़ी डेडिकेशन तो, और तुसी जो अच्छे अच्छे कॉलेजां दे विच अपने माता पिता का बड़ा कीमती जो उन्होंने पैसा कमाया उन्होंने खर्च के इत्थे एजुकेशन लैना दिओ. और मैनू ये दसते हुए बड़ी खुशी हुंदी आ कि साडा जिहड़ा ये ट्रस्ट है लगभग 35-40 साल पुराना. साडे कोल नर्सिंग कॉलेज है, हॉस्पिटल है और एक पब्लिक स्कूल है. एंड असी बहुत अच्छा काम कर रहे हैं. मैं अपने वालों नहीं कहता, इलाके भी है. और पैरामेडिकल कॉलेज असी इस वाल खोलिया, पर साढ़े पैरामेडिकल कॉलेज विच मैं कहना एक खासियत जरूर है कि साढ़े कोल डेडिकेटेड अपना हॉस्पिटल है और उहदे विच साढ़े कोल जिहड़े मैडिकल दे इक्विपमेंट गैजेट्स लगे हुए आ वो भी अपने आप दे विच बड़े लेटेस्ट और बड़े टैक्नीक वाले आ. और असी जिन्ने साढ़े स्टूडेंट आ असी उन्होंने गैजेट्स के उत्ते उन्होंने इक्विपमेंट के उत्ते उन्होंने काम करने लिए लिबर्टी दिन्ने आ और वो हाथ भी ला सकते हैं, चला भी सकते हैं, पुछ भी सकते हैं. और सब तो वड्डी गल की है साडा, अगर तुसी मैं वेरी प्राउड कि साडा जिहड़ा तुसी कैंपस देखिया 34-35 साल के 35 एकड़ के साडा कैंपस है. साडे को बहुत बहुत अच्छे डॉक्टर आ, बहुत बहुत अच्छे साडे नर्सिंग के फैकल्टी आ. स्कूल दे विच भी साडे कोल बहुत अच्छे फैकल्टी आ. साडे सामने थोड़े बार बार थोड़े सामने सर हरबंस सिंह बोलीना जी इत्थे आए. ये साडे डायरैक्टर है, ही इज़ टेकिंग केयर ऑफ द एजुकेशन ऑफ द चिल्ड्रन. और सब तो वधिया गल है कि इन्हां दा अपना बड़ा वड्डा पिछे इतिहास है. एक लायलपुर खालसा कॉलेज विच पढ़ाते भी रहे और इन्होंने बच्चों को बहुत वड्डियां सेहतां दित्तियां. मैनू अज दे इवेंट दे विच जिन्ने भी होर जिहड़ा प्रोग्राम है, मैं उम्मीद करदा कि जिन्ना भी जिहड़ा प्रोग्राम होएगा वधिया होएगा, मोटिवेटेड होएगा. साडे वास्ते अगे वास्ते सानू हौसला होएगा कि इदां दे जिहड़े इवेंट आ सानू जो मर्जी कहो असी ऑर्गेनाइज करने नूं तैयार हैं. साडे ते बाबे नानक दी किरपा, इस लिए कोई फिक्र नहीं हैगा. असी इहदे नाल भी वधिया अगे वास्ता करके देवांगे. और असी तुहाडा सारिआं दा अखीर दे विच सारिआं दे विच बच्चों का जिहड़े बाहरों आए हैं और बड़े एमिनेंट फैकल्टी परसनस भी आए हैं, मैं उन्होंने इत्थे आउण दी जी हाँ आखदा और उम्मीद करदा कि साडा जिहड़ा अज दा प्रोग्राम है ये इन्हां दी बदौलत ही इस दिन 4 चंद लगणगे. थैंक यू वेरी मच. वाहिगुरू जी का खालसा, वाहिगुरू जी की फतेह.
Thank you so much, sir, for your valuable message. A big round of applause for Mr. Hardev Singh Kama. And also we welcome our medical superintendent, Dr. Ravinder Khajuria. A big round of applause, our medical superintendent, Dr. Ravinder Khajuria.
Thank you, and thank you for giving me the opportunity to welcome all our esteemed guests who are here visiting us on this first paramedical meet. And I thank our president, Mr. Hardev Singh Kama ji, to allow us to do this function, directors of respected trustees, and all the faculty that we have here, and the most important of all, the students that we have here. I wish you all the best and wish you all the luck. Hope to have a very successful first national paramedic meet, and but in whatever way, we are always here for you. Thank you and have a good time. Thank you.
Thank you so much, sir. जो दिल का हो खूबसूरत, जो दिल का हो खूबसूरत, खुदा ने ऐसे लोग कम बनाए हैं. जो दिल का हो खूबसूरत, खुदा ने ऐसे लोग कम बनाए हैं. और जिन्हें ऐसा बनाया है खुदा ने, जिन्हें ऐसा बनाया है खुदा ने, वो आज हमारी महफिल में आए हैं. The most awaited section of this first paramedic meet 2023 has begun now. Let's welcome our first speaker on the stage, Dr. Saurav Gupta, Assistant Professor, Mata Gujri College, Fatehgarh Sahib. Give a huge round of applause for Dr. Saurav Gupta.
Thank you all for giving me the opportunity to deliver a talk on the basics that we use in the field of microbiology, in the field of paramedical staff for the hospitals. Microscopy. Before starting the presentation about microscopy, my first slide, it is about how we utilize the resources or what we study. The more we learn, the more we see. If you have the desire to learn, to read, to do, only then you can see beyond the limits. And the other thing, it doesn't matter how many resources you have. If you don't know how to use the resources, it is never be enough. I have choose this topic, microscopy, as from 10th onwards, our students, they start learning about it. They start using microscope, but even in their UG, PG classes, they are not comfortable. They don't know how to use it, how to get maximum output of it. Next. If I talk about the history, the first microscope that was used, useful microscope was used by Anton von Leeuwenhoek. And you will be surprised, this person was not a scientist, not a researcher, not from a science background. He was a cloth merchant. And he was just observing the fabric using his magnifying glass. But his vision, his lust, his curiosity led him to develop a microscope. This picture is of that microscope, traditional microscope that he used. And nowadays, we have sophisticated microscopes in our lab, but still fails to get the useful out of it. This microscope, it is of single lens as the magnifying glass that we use. At that time, he observed tea scrapings, rainwater, peppercorn infusions. At that time, technology was not this much advanced. People who were having some unusual observations, they write letter to Royal Society of London. And whatever he observed in 16th, 17th century, it is still valid and it is appreciated by a microbiologist even these days. So, whenever we talk about the microscopy and we say there are two types of microscopes, one is the light microscopy, another one is the electron microscopy. In all the institutes, labs, we have the light microscopes. No doubt there are the variants towards these microscopes, but if someone says we have the electron microscope, we have something else, no. Maximally, our laboratories, they have the light microscope, and in the light microscopy, we have different variants. Bright field microscopy, it is there, dark field, phase contrast, fluorescent, and these days we are using the compound microscopes, we are not using the simple microscopes. After Anton von Leeuwenhoek, there was a gap of 200 years. No further development take place in this field. Reason? Good quality lenses were not there. A compound microscope was developed, but with minimal resolution and poor magnification. So, of no use. In the 19th century, the microscopy, it started flourishing again. Now, the principle of microscopy, what we can observe under microscope. One of my colleagues usually say, can we observe elephant under microscope? कि ਅਸੀਂ हाथी देख सकते हैं? People said no. Reason is, sir, it is too big. It is not only too big, but the light will not pass through the elephant. This is the reason. To observe anything under microscope, light need to pass. And this light, when it passes, it all depends the medium through which it passes. refraction and refractive index plays an important role. I think in your +1, +2 classes you have studied this phenomenon where the people talk about when the light enters in a medium, it either bends towards or away from the normal depending upon the density. So when a refractive index is a measure of how greatly a substance slows a velocity of light and the direction along with the magnitude of bending by the medium. Air, its refractive index it is 1, glass, its refractive index is 1.3. How the light rays focus by the lens when we adjust the knobs, coarse adjustment and fine adjustment knobs, we tend to focus the specimen. That lens helps to collect the rays of light, then refract it and we observe it. This is the microscope we use these days. In most of our labs, this microscope it is available, and we usually call this microscope as light microscope. But some of my colleagues, they might have seen the traditional microscope where the source of light, it was sun. Sunlight was used. That is also a light microscope. That is also a light microscope, but our mindset, okay, this is the light microscope, that is the simple microscope. That is also light microscope, that is also a compound microscope. Compound microscope means where we use combination of lenses. 2 or more than 2 lenses are there. Now, what is the capacity of the microscope to magnify the image? Magnification, it is not only the thing that is required when we work with the microscope, it is the resolution. These days we all are using the mobile smartphones, and we usually ask the vendor, what is the resolution of my camera? That resolution means what is the capacity of your camera to separate two closely placed points or objects. That is the resolution. And the useful resolution is must when we work with the microscope. Resolution, it is the ability of a lens to separate between small objects that are close together. And the minimum distance, it is determined by an equation called absorption. Lambda, it is the wavelength of light, and I think we all are from the science background. And when we use light as a source, the visible range, it starts from 300 nanometer up to 600, 700 nanometer. That is fixed. You can't go beyond it. Lambda is fixed, 0.5 it is fixed, and it is a refractive index. Refractive index, it is depending upon the medium. Air, it is 1, glass, it is 1.34. Then theta, it is the angle. When we work on the microscope, this angle, half of the angle, it decides theta. And sine theta, sine 90, its value is 1, and it's the maximum value. You can't go beyond it. You can't go beyond it. So the lenses with larger angular and numerical aperture, its resolution is greater and its working distance would be smaller. I think all of you have worked with the microscopes. When you are working with the microscope, you place the specimen on the stage and focus at 10x, objective 10x. If you have closely observed that distance between the objective lens and the stage, it is in centimeters. Once you focus it, then you shift it to 40x, magnification power 40x of the objective lens, and you observe the working distance between the stage and the lens, it decreases. And when you go beyond it, say 100x, the working distance further shortens. And we put a drop of oil that increases the refractive index, number of rays entering the tube, it increases manifold, and we get better picture, better resolution, better magnification by the microscope. So we have the different objectives: 4x, 10x, 40, 45x, then 100x, numerical aperture and sin theta, 0.1, 0.25, 0.55 and 1.25 up to 1.4, because oil and glass have the same refractive index. Focal length 40 nanometers, 16, 4 and 1.8 to 2 millimeters. Just it is touching the stage when we use the oil immersion. Working distance, it further decreases. Resolving power up to 0.2 micrometer, means you can clearly observe at least bacteria. I am not talking about the eukaryotic organisms, say blood cells or the eukaryotic cells. I am talking about the prokaryotic, especially bacteria, the pathogens. You can clearly observe under the microscope. And these lenses, scanning, low power, high power, oil immersion, these are parfocal. Parfocal means, I don't know you people are aware of or not, when we shift the lens from 10x to 40x, student have the mind, now my lens will touch the stage. So what they do, they rotate the coarse adjustment knob so that your lens, it should not touch the stage. But your microscopes are designed in such a way, once you focused your microscope objective lens at 10x, if you rotate the lens to 40x, it will be in focus. Parfocal means you can change the lens, but the object, the specimen will remain in focus. It will not change the focus, the specimen, it is in focus. So just the fine adjustment knobs, it is sufficient to see the specimen. Usually we commit this type of mistake that I would like to convey. The variants, the first one, the bright field microscope that we usually use, I have talked about the principle, what to do, how to focus it. Then the dark field microscope. Usually the bright field microscope, it is used for the stained cell. When we talk about bacteria, it is unicellular organism, and the contrast, it is minimal. Contrast is minimal between the background and the cell, water and the cell, so it is tough to observe. So what do? We do the staining, and that staining increases the contrast and we observe the organism. But what if you want to observe unstained cell, live cells, so that the staining solution or staining dye is not changing the morphology of the cell? So we have the dark field microscopy, variant of bright field. We are using the source light. Live unstained cells or organisms are observed. Hollow cone of light is focused on the specimen. Unreflected and unrefracted rays do not enter the objective. Principle is same, reflection, refraction of light. Only light that has been refracted by the specimen form the image. Field surrounding the specimen appears dark, while the object itself is brightly illuminated, because the light that enters in the hollow tube, it is the light that passes through the specimen, not through the background. So background is dark, while your specimen it is brightly illuminated. In your bright field, just opposite was there. Phase contrast microscope, again a variant of light microscope. We changes the phase of light. We know light move in a zigzag manner, that is alternate crest and tufts are there. So we change the phase, and that change in the phase helps to get a clear picture, to get the information about the organelles within the cell better way. Condenser of the phase contrast microscope, there is an annular loop, stop an opaque disc with a transparent ring that helps in producing the hollow cone of light. We have the annular loop over there that stops the light to enter from the all illuminated area, only the light area that allows the from where the light enters. And once the light enters, then we have a phase ring. Again the phase ring, in the phase ring we have the grooves, that grooves results in further change in the phase of the light that enters in the specimen, and the light that enters through the specimen, it is retarded by half of the wavelength as compared to the light that pass as such without passing through the specimen. And both of these lights rays, when superimposed, they form an image, clear image of an object. Structures are revealed beautifully using the phase contrast microscope. Then we have the fluorescent microscope. Again the source, it is light. Source, it is light only. Here we use high energy radiations, low wavelength. Some molecules have the property to absorb light. They become excited and later release energy, and that energy is released. Now the light, it is of longer wavelength, it is emitted, and that longer wavelength light can be perceived, can be seen by our eyes, and we use it in the fluorescent microscopes. Here we use a mercury vapor arc lamp that produces the light. We have the exciter filter that allow the entry of shorter wavelength radiations only, from 200 nanometer to 400 nanometer. Mirror is there that direct the light to the specimen. Now specimen, it is stained with the fluorescent dye, it absorb the light, now get excited. Now after excitation it will come back to the base, emitting the radiation of longer wavelength. Again we have a barrier filter over there to avoid the entry of UV radiations, lower wavelength radiations to our eyepiece, to our eyes, to protect our eyes, and we can see the objects by the fluorescent microscopy. Here we use the immunological assays using the fluorescent microscopy. Then comes the electron microscopy. These days electron microscopy in our region, GNDU, Punjab University, even the Central University Bathinda, they own the electron microscope. We don't have. Our institutions don't have the electron microscope. Generally students say we have the electron microscope. We are not having. Here we use electron beam as the source of radiations, and those electrons can be directed, can be focused. They can illuminate the specimen, and the resolution, it is increased beyond the limits. If we compare the light and the electron microscopes, magnification in the light microscope, whatever the variant is maximum 1500x, 1500 times. But when we talk about the electron microscope, it may reach up to 5 lakhs, over 1 lakh. Resolution 0.2 micrometer, and in electron microscope it is 0.5 nanometers. You can observe viruses using the electron microscopes. Radiation source, visible light in our labs. Electron microscope, it is an electron beam. Medium of travel, we keep our microscope in light microscope in the tabletop, while electron microscopes, these are operated in vacuum. Type of lens, here it is glass, and in electron microscope we have the electromagnet. Source of contrast, differential light absorption when we use the dyes. Here the scattering of electron, then the focusing mechanism. We adjust the lens position mechanically using the coarse and fine adjustment knob, and here we use current to the magnetic lens, we variate it. How you can change the magnification? We rotate the objective lens. Electron microscope, again we adjust the current. Specimen, we usually prepare the glass slide in light microscopy, and in electron microscopes we use the metal grids. Copper grids are there on which we mount our specimen. So range, what you can observe using the electron microscope: epithelial cell, red blood cell, bacteria, mycoplasma, viruses, proteins, amino acid, even atoms. It is possible. In electron microscopy, we have two variants, SEM and TEM, scanning electron microscope and transmission electron microscope. As the name indicates, transmission, through which the electron transmits, passes. Scanning, where the electron is not passing, they are just scanning the surface. A heated tungsten filament, it is used for generation of electron beam. Electron can't pass through the glass. Electromagnets are there. We have the columns. Denser region in the specimen scatter more electrons and therefore appear darker in the image, since fewer electrons strike the area of the screen. The specimen, in the beginning I talked, when can we observe elephant under microscope? No, refraction. And whenever we prepare the specimen, tissue the section ਕੱਟਦੇ ਹਾਂ ਅਸੀਂ, you use the microtome. ਮਾਈਕਰੋਟੋਮ ਯੂਜ਼ ਕਰਦੇ ਹਾਂ ਅਸੀਂ, ਪੈਰਾਫਿਨ ਵੈਕਸ ਹੁੰਦਾ ਹੈ ਤੇ ਉਹਦੇ ਵਿੱਚ ਸਪੈਸੀਮਨ ਨੂੰ ਮਾਊਂਟ ਕਰਦੇ ਹਾਂ, ਉਸ ਤੋਂ ਬਾਅਦ ਅਸੀਂ ਸੈਕਸ਼ਨਸ ਕੱਟ ਕਰਕੇ ਉਹਨਾਂ ਨੂੰ ਆਬਜ਼ਰਵ ਕਰਦੇ ਹਾਂ. ਬਟ ਵੈਨ ਵੀ ਯੂਜ਼ ਦ ਇਲੈਕਟ੍ਰੋਨ ਮਾਈਕਰੋਸਕੋਪ, here we use an instrument that is called ultra microtome. Ultra microtome that cut the bacterial cell. Just imagine bacterial cell ਦਾ ਸਾਈਜ਼ ਕੀ ਹੈ ਤੇ ਅਸੀਂ ਉਹਦੇ ਵੀ ਸੈਕਸ਼ਨ ਕੱਟਦੇ ਹਾਂ. ਕਿੰਨਾ ਕੁ ਥਿਨ ਸੈਂਪਲ ਹੋਏਗਾ, ਸਪੈਸੀਮਨ ਹੋਏਗਾ, ਜਿਹਨੂੰ ਅਸੀਂ ਇਲੈਕਟ੍ਰੋਨ ਮਾਈਕਰੋਸਕੋਪ, ਟਰਾਂਸਮਿਸ਼ਨ ਇਲੈਕਟ੍ਰੋਨ ਮਾਈਕਰੋਸਕੋਪ ਦੇ ਅੰਡਰ ਆਬਜ਼ਰਵ ਕਰ ਰਹੇ ਹਾਂ. How it works, we usually take the picture on the fluorescent screen on the computer. How the specimen it is prepared for electron microscopy. 20 to 100 nanometer thick, a typical bacterial cell, its size it is 5 micrometer, and we need a specimen less than it, 20 to 100 nanometer thick. 1/50 to 1/10 of the diameter of bacterium, and able to maintain its structure when bombarded with the electron under high vacuum. Electrons are easily absorbed and scattered by solid matter, so thin slices can be viewed. Specimens are fixed with glutaraldehyde, osmium tetroxide, dehydrated, then soaked in unpolymerized liquid epoxy plastic, then cut with the ultra microtome, and this specimen, then it is observed under the microscope. Before observing, we go for the staining. Biological macromolecule contains hydrogen, carbon, nitrogen and oxygen only. These are the 4 elements present in the cell in the biological system. Almost same atomic number, nearly same atomic number, and electron scattering, it is fairly constant. So what we do, we stain the cell with the heavy metals like lead citrate or uranyl acetate, bind to the cell structure, make them electron opaque and increase the contrast, and that contrast helps us to observe the specimens under the microscope. This is the variation that we use. Metal shadowing, it is there. Heavy metals such as platinum or gold, it is sprayed at the angle so that microbes, these are stained from one side. Metal piles up on the one side of the specimen, and uncoated area on the opposite side leaves a clear area behind its shadow to observe the 3D picture. Freeze etching, it is another variant that we use. I will not discuss it in detail. This is scanning electron microscope to observe the surface of the microorganism in great detail. Here, the surface topography of the specimen, it is observed. Electrons are emitted by an object surface rather than from transmitted. Electrons are not transmitted here. Specimen preparation is easy, no ultramicrotome is required. You just prepare the powdered sample, and that powdered sample is filled in a cavity, and that is placed in the scanning electron microscope. 3-dimensional view can be observed. The electron gun, this is the system we use in the scanning electron microscope. Comparison between the electron which are not scattered and the electrons scattered by the specimen, that helps us to observe the specimen. This is all about the microscopy, basics of microscopy, how we do, what to do, what type of precautions we need to take care of. Thank you.
Thank you so much, sir, for your knowledgeable presentation. Now I would like to call our convener, Mr. Brinder Singh Barat, to share their views on the event. Please welcome him with a huge round of applause.
Respected President Sir, Sardar Dev Singh Kama, Director Health, Sardar Shvinder Singh Ji Gill, Director Education, and Amarjit Singh Sir, Chairman Finance, Sardar Kulvinder Singh Ji, General Secretary, and all the dignitaries who are coming from all over India, and my hospital team, Medical Superintendent Mr. Saini, Gynecologist Dr. Madam Aman, and all doctors, Sohta ji and others. ਜਿਹੜਾ ਅੱਜ ਦਾ ਇਵੈਂਟ ਸ਼ੁਰੂ ਕੀਤਾ ਹੈ ਉਹ ਪੈਰਾਮੈਡੀਕਲ ਮੀਟ ਹੈ. ਦਿਸ ਇਜ਼ ਦਾ ਫਸਟ ਪੈਰਾਮੈਡੀਕਲ ਮੀਟ ਫਾਰ ਆਵਰ ਇੰਸਟੀਟਿਊਸ਼ਨ. ਮੈਨੂੰ ਪਹਿਲਾਂ ਤਾਂ ਬੜਾ ਖੁਸ਼ੀ ਹੈ ਕਿ ਤੁਸੀਂ ਇੰਨੀ ਦੂਰੋਂ ਗਾਜ਼ੀਆਬਾਦ ਤੋਂ, ਦੇਹਰਾਦੂਨ ਤੋਂ, ਕਈ ਬੱਚੇ ਤਾਂ ਸਾਡੇ ਜਿਹੜੇ ਜੰਮੂ ਕਸ਼ਮੀਰ ਤੋਂ ਉਹ ਵੀ ਆਏ ਨੇ ਇੱਥੇ. ਇਸ ਲਈ ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਮੈਂ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਇੱਥੇ ਵੈਲਕਮ ਕਰਦਾ ਸਾਡੀ ਇੰਸਟੀਚਿਊਟ ਦੇ ਵਿੱਚ. ਅਤੇ ਸੈਕੰਡਲੀ ਮੈਂ ਇੱਕ ਗੱਲ ਕਹਿਣਾ ਚਾਹੁੰਦਾ, ਮੈਂ ਆਪਣੀ ਇੰਸਟੀਚਿਊਟ ਬਾਰੇ ਥੋੜ੍ਹਾ ਦੱਸਣਾ ਚਾਹੁੰਦਾ ਤੁਹਾਨੂੰ. ਜਿਹੜੀ ਸਾਡੀ ਇੰਸਟੀਚਿਊਟ ਹੈ 30-32 ਸਾਲ ਪੁਰਾਣੀ ਇੰਸਟੀਚਿਊਟ ਹੈ. ਇਹਦੇ ਵਿੱਚ ਜਿੰਨੇ ਹੀ ਬੰਦੇ ਕੰਮ ਕਰਦੇ ਆ ਸਾਨੂੰ ਸੋਚ ਕੇ ਹੈਰਾਨੀ ਹੋਏਗੀ, ਜਿੰਨੇ ਮੇਰੇ ਟਰਸਟੀ ਆ ਇੱਥੇ ਉਹ ਕੋਈ ਵੀ ਪੇ ਨਹੀਂ ਲੈਂਦੇ, ਸਿਰਫ ਇੱਥੇ ਸੇਵਾ ਕਰ ਲੈਂਦੇ. ਇਟ ਇਜ਼ ਦਾ ਫਸਟ ਥਿੰਗ ਜੋ ਮੈਂ ਤੁਹਾਨੂੰ ਦੱਸਣਾ ਚਾਹੁੰਦਾ. ਸੈਕੰਡਲੀ ਮੈਂ ਇੰਸਟੀਚਿਊਟ ਨੂੰ ਇਹ ਦੇਖਿਆ
ਅਸੀਂ ਇੱਕ ਇੱਥੇ ਸੇਵਾ ਕਰਦੇ ਹਾਂ, ਜਿਹੜੀ ਸਾਡੀ ਇੱਕ ਬ੍ਰਾਂਡ ਹੈ, ਤੁਸੀਂ ਬ੍ਰਾਂਡ ਮੰਨ ਲਓ, ਜਾਂ ਅਸੀਂ ਗੁਰੂ ਨਾਨਕ ਦੇ ਨਾਂ ਦੇ ਉੱਤੇ ਸਾਰੇ ਜਿੰਨੇ ਸਾਡੇ ਪੇਸ਼ੈਂਟਸ ਹੁੰਦੇ ਹੈ ਅਤੇ ਜਿਨ੍ਹਾਂ ਦੇ ਅਟੈਂਡੈਂਟ ਹੁੰਦੇ ਹੈ, ਅਸੀਂ ਉਹਨਾਂ ਨੂੰ ਲੰਗਰ ਦਿੰਦੇ ਹਾਂ। ਲੰਗਰ ਮੀਨਸ ਫ੍ਰੀ ਫੂਡ। ਅਸੀਂ ਸਾਰਿਆਂ ਨੂੰ ਫ੍ਰੀ ਫੂਡ ਦਿੰਦੇ ਹਾਂ, ਜਿੰਨੇ ਵੀ ਇੱਥੇ ਅਟੈਂਡੈਂਟ ਆਉਂਦੇ ਹੈ ਜਾਂ ਉਹਨਾਂ ਦੇ ਪੇਸ਼ੈਂਟ ਹੁੰਦੇ ਆ ਸਾਰਿਆਂ ਨੂੰ। ਇਸ ਲਈ ਅਸੀਂ ਇੱਥੇ ਸਿਰਫ ਅਤੇ ਸਿਰਫ ਪੈਰਾਮੈਡੀਕਲ ਕਾਲਜ ਵੀ ਹੋ ਗਿਆ, ਸਾਡਾ ਨਰਸਿੰਗ ਕਾਲਜ ਵੀ ਹੋ ਗਿਆ, ਅਸੀਂ ਸਿਰਫ ਇੱਥੇ ਸੇਵਾ ਲਈ ਅਤੇ ਬੱਚਿਆਂ ਦੀ ਐਜੂਕੇਸ਼ਨ ਲਈ ਇੱਥੇ ਕੰਮ ਕਰ ਰਹੇ ਹਾਂ, ਤਾਂ ਕਿ ਸਾਰੇ ਇਲਾਕੇ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਇੱਥੇ ਆਇਓ, ਪਤਾ ਕਰੋਗੇ ਸਾਡੇ ਜਿਹੜੀ ਇੰਸਟੀਚਿਊਟ ਹੈ, ਇਹ ਇੰਸਟੀਚਿਊਟ ਸਿਰਫ ਅਤੇ ਸਿਰਫ ਕੋਈ ਅਸੀਂ ਇੱਥੋਂ ਪੈਸਾ ਨਹੀਂ ਕਮਾ ਰਹੇ। ਕਈ ਲੋਕਾਂ ਨੂੰ ਹੁੰਦਾ ਵੀ ਪੈਸਾ ਕਮਾ ਰਹੇ ਹਾਂ, ਕੋਈ ਫਾਈਨੈਂਸ਼ੀਅਲੀ ਕੁਛ ਕਰ ਰਹੇ ਹਾਂ, ਬਟ ਅਸੀਂ ਸਿਰਫ ਲੋਕਾਂ ਦੀ ਸੇਵਾ ਲਈ ਇੱਥੇ ਇਹ ਇੰਸਟੀਚਿਊਟ ਖੋਲ੍ਹੀ ਹੈ। ਪੈਰਾਮੈਡੀਕਲ ਕਾਲਜ ਖੋਲ੍ਹਣ ਦਾ ਵੀ ਸਾਡਾ ਇਹੀ ਸੀ, ਤਾਂ ਕਿ ਅੱਜ ਕੱਲ੍ਹ ਜੋ ਨਵੀਆਂ ਟੈਕਨੀਕ ਸਾਰੀਆਂ ਰੇਡੀਓਲੋਜੀ ਦੀਆਂ, ਰੇਡੀਓਲੋਜੀ ਡਾਕਟਰ ਨਹੀਂ ਮਿਲ ਰਹੇ ਅੱਜ ਕੱਲ੍ਹ ਆਪਾਂ ਨੂੰ, ਨਾ ਸਾਨੂੰ ਓਟੀ ਆਪਰੇਟਰ ਮਿਲ ਰਹੇ ਹੈ, ਨਾ ਸਾਨੂੰ ਮਾਈਕਰੋਬਾਇਲਿਸਟ ਮਿਲ ਰਹੇ ਹੈ। ਉਸ ਲਈ ਤੁਸੀਂ ਜੋ ਇਹ ਕੋਰਸ ਸਾਰਿਆਂ ਨੇ ਜੁਆਇਨ ਕੀਤਾ ਪੈਰਾਮੈਡੀਕਲ ਕਾਲਜ, ਮੈਂ ਦੇਖ ਰਿਹਾ ਵੀ ਇਹ ਅੱਗੇ ਬਹੁਤ ਹੀ ਜ਼ਿਆਦਾ ਇਹਦਾ ਜਿਹੜਾ ਭਵਿੱਖ ਹੈ ਇਹ ਬਹੁਤ ਹੀ ਜ਼ਿਆਦਾ। ਬਾਕੀ ਸਾਡੇ ਕਾਲਜ ਦੇ ਵਿੱਚ ਮੈਂ ਇੱਥੇ ਕਿਉਂਕਿ ਐਜ਼ ਏ ਕਨਵੀਨਰ, ਐਜ਼ ਏ ਮਾਰਕੀਟਿੰਗ, ਮੈਂ ਇੱਥੇ ਮਾਰਕੀਟਿੰਗ ਵੀ ਸਾਡੀ ਕਾਲਜ ਦੀ ਕਰਨਾ ਚਾਹੁੰਦਾ। ਇਹਦੇ ਵਿੱਚ ਇਹ ਹੈ ਵੀ ਜਿਹੜਾ ਬੱਚਾ ਸਾਡੇ ਕੋਲ ਇੱਥੇ ਆਏਗਾ ਉਹਨੂੰ ਅਸੀਂ ਸਪੈਸ਼ਲ ਕੰਸੈਸ਼ਨ ਦੇਵਾਂਗੇ। ਸਪੈਸ਼ਲ ਕੰਸੈਸ਼ਨ ਜੋ ਵੀ ਬੱਚਾ ਸਾਡੇ ਕੋਲ ਆਏਗਾ ਸਾਡੀ ਉਹਨੂੰ ਸਪੈਸ਼ਲ ਕੰਸੈਸ਼ਨ ਦਿੱਤਾ ਜਾਏਗਾ ਨੈਕਸਟ ਈਅਰ ਤੋਂ, ਅਤੇ ਨੈਕਸਟ ਈਅਰ ਦੇ ਵਿੱਚ ਅਸੀਂ ਆਪਣੇ ਕਾਲਜ ਨੂੰ ਹੋਰ ਵੀ ਅੱਗੇ ਵਧਾਵਾਂਗੇ। ਤੁਸੀਂ ਸਾਡੇ ਕਾਲਜ ਦੀ ਸਾਰੀਆਂ ਫੈਸਿਲਿਟੀਆਂ ਦੇਖ ਸਕਦੇ ਹੋ, ਮੇਰੇ ਸਾਰੇ ਡਾਕਟਰਸ ਬੈਠੇ ਆ ਇੱਥੇ, ਤੁਸੀਂ ਕੋਈ ਵੀ ਬੱਚਾ ਮੇਰੇ ਡਾਕਟਰ ਤੋਂ ਜਾ ਕੇ ਕੁਝ ਵੀ ਪੁੱਛ ਸਕਦਾ ਹੈ, ਰੇਡੀਓਲੋਜਿਸਟ ਤੋਂ ਪੁੱਛ ਸਕਦਾ ਹੈ, ਆਪਰੇਸ਼ਨ ਥੀਏਟਰ 'ਤੇ ਹੈ ਡਾਕਟਰ ਅਨਥੀਸੀਆ ਵਾਲੇ ਆ ਸਾਡੇ, ਉਹਨਾਂ ਤੋਂ ਪੁੱਛਿਆ ਜਾ ਸਕਦਾ ਹੈ। ਤੁਸੀਂ ਸਾਰੇ ਦੇ ਸਾਰੇ ਪ੍ਰੈਕਟੀਕਲ ਪੜ੍ਹਾਈ ਕਰੋਗੇ। ਅਸੀਂ ਥਿਓਰੀਟੀਕਲ ਪੜ੍ਹਾਈ ਨੂੰ ਛੱਡ ਕੇ ਪ੍ਰੈਕਟੀਕਲ ਪੜ੍ਹਾਈ ਕਰਨੀ ਆ ਰਹੇ ਹਾਂ। ਤੁਸੀਂ ਜਿਹੜਾ ਸਾਡਾ ਬੈਚ ਚੱਲ ਰਿਹਾ ਉਹਨਾਂ ਨੂੰ ਪੁੱਛੋ, ਉਹਨਾਂ ਨੂੰ ਦੇਖੋ ਵੀ ਉਹ ਕਿਵੇਂ ਰੇਡੀਓਲੋਜੀ 'ਤੇ ਕੰਮ ਕਰਦੇ ਹੈ, ਅਲਟਰਾਸਾਊਂਡ ਮਸ਼ੀਨ 'ਤੇ ਕੰਮ ਕਰਦੇ ਹੈ, ਉਹ ਸਾਰੇ ਐਕਸਰੇ 'ਤੇ ਕੰਮ ਕਰਦੇ ਹੈ, ਉਹ MRI 'ਤੇ ਕੰਮ ਕਰਦੇ ਹੈ। ਇਸ ਕਰਕੇ ਮੈਂ ਬਹੁਤ ਕਾਲਜਸ ਵਿੱਚ ਦੇਖਿਆ, ਕਾਲਜਸ ਦੇ ਵਿੱਚ ਕਾਲਜ ਹੈ ਇਕੱਲੇ, ਪਰ ਹੌਸਪੀਟਲ ਨਹੀਂ ਹੈ ਉੱਥੇ। ਸਾਡਾ ਨਾਲ ਹੌਸਪੀਟਲ ਹੈ। ਇਸ ਕਰਕੇ ਅਸੀਂ ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ, ਤੁਸੀਂ ਜਿਹੜੇ ਤੁਹਾਡੇ ਜੂਨੀਅਰਸ ਹੈ ਜਾਂ ਹੋਰ ਬੱਚੇ ਆਉਣਾ ਚਾਹੁੰਦੇ ਹੈ, ਉਹ ਸਾਡਾ ਕਾਲਜ ਦੇਖੋ, ਵਿਜ਼ਿਟ ਕਰੋ। ਅੱਜ ਸਾਡੇ ਆਪਰੇਸ਼ਨ ਥੀਏਟਰ ਦੇਖੋ, ਵੀ ਹੈਵ 4 OTs, ਤੁਸੀਂ ਦੇਖ ਕੇ ਹੈਰਾਨ ਰਹੋਗੇ। ਵਰਲਡ ਕਲਾਸ OTs ਨੇ ਸਾਡੀਆਂ, ਉਹ ਤੁਸੀਂ ਦੇਖ ਸਕਦੇ ਹੋ। ਸਾਰੇ ਬੱਚੇ, ਮੈਂ ਸਾਰਿਆਂ ਨੂੰ ਕਹਾਂਗਾ ਜਦੋਂ ਟਾਈਮ ਮਿਲਿਆ ਤੁਸੀਂ ਸਾਡਾ ਹੌਸਪੀਟਲ ਜ਼ਰੂਰ ਦੇਖਿਓ ਇੱਕ ਵਾਰੀ, ਤਾਂ ਕਿ ਤੁਹਾਨੂੰ ਪਤਾ ਚੱਲੇਗਾ ਕਿ ਸਾਡੇ ਹੌਸਪੀਟਲ 'ਚ ਕੀ ਕੀ ਫੈਸਿਲਿਟੀਜ਼ ਆ। ਸੈਕੰਡਲੀ, ਇੰਨੇ ਜਿਹੜੇ ਸਾਡੇ ਡਿਗਨਿਟੀ ਇੱਥੇ ਆਏ ਆ, ਮੈਂ ਉਹਨਾਂ ਥੈਂਕਫੁਲ ਹਾਂ ਕਿ ਉਹਨਾਂ ਨੇ ਇੱਥੇ ਆ ਕੇ ਸਾਡਾ ਮਾਣ ਵਧਾਇਆ, ਸਾਡਾ ਹੌਸਲਾ ਵਧਾਇਆ। ਸਾਨੂੰ ਮਹਿਸੂਸ ਹੋ ਰਿਹਾ ਵੀ ਹਾਂ ਸਾਡਾ ਵੀ ਕੋਈ ਇੰਸਟੀਚਿਊਟ ਹੈ, ਅਤੇ ਇੰਸਟੀਚਿਊਟ ਦੇ ਵਿੱਚ ਸਾਡੇ ਕਹੇ 'ਤੇ ਤੁਸੀਂ ਇੰਨੇ ਲੋਕ ਇੱਥੇ ਆਏ ਹੋ, ਜਿਹਦੇ ਵਿੱਚੋਂ ਮੇਨ ਜਿਹੜਾ ਇੱਥੇ ਯੋਗਦਾਨ ਹੈ ਉਹ ਮਿਸਟਰ ਰਾਜਦੀਪ ਹੈ, ਡਾਕਟਰ ਰਾਜਦੀਪ, ਉਹਨਾਂ ਦੇ ਨਾਂ ਦੀ ਤਾੜੀਆਂ। ਜੋ ਅੱਜ ਉਹਨਾਂ ਨੇ ਇੱਕ ਸਾਰਾ ਜਿਹੜਾ ਮੀਟ ਦਾ ਪ੍ਰਬੰਧ ਹੈ, ਸਾਰਾ ਦਿਨ ਅਸੀਂ ਦੋਨੋਂ ਜਾਣੇ ਗੱਲ ਕਰਕੇ ਇਸ ਪ੍ਰਬੰਧ ਕੀਤਾ। ਮੈਂ ਉਹਨਾਂ ਦੇ ਪ੍ਰਬੰਧ ਲਈ ਬੜਾ ਥੈਂਕਫੁਲ ਹਾਂ ਕਿ ਉਹਨਾਂ ਨੇ ਹਰ ਚੀਜ਼ ਪਲਾਨ ਕੀਤੀ, ਪੂਰੀ ਹਰ ਚੀਜ਼ ਪਲਾਨ ਸੀ। ਕਿੰਨੇ ਬੱਚੇ ਆਣੇ ਹੈ, ਕਿੱਥੋਂ ਬੱਚੇ ਲੈਣੇ ਹੈ, ਕਿਹੜੇ ਕਾਲਜ ਤੋਂ ਆਣੇ ਹੈ, ਅਤੇ ਉਹਨਾਂ ਨੇ ਆਪਣਾ ਜਿਹੜਾ ਅਸੀਂ ਤੁਹਾਡੇ ਤੋਂ ਕੁਛ ਜੋ ਕਿ ਰੱਖੀ ਸੀ, ਥੋੜ੍ਹੀ ਜਿਹੀ ਫੀਸ ਲਈ ਹੈ ਤੁਹਾਡੇ ਤੱਕ। ਅਗਲੇ ਵਾਰੀ ਅਸੀਂ ਤੁਹਾਡੇ ਤੋਂ ਫੀਸ ਨਹੀਂ ਲਾਂਗੇ। ਇਸ ਵਾਰੀ ਅਸੀਂ ਫੀਸ ਲਈ ਹੈ, ਅਗਲੀ ਵਾਰ ਤੁਹਾਡੇ ਤੋਂ ਕੋਈ ਫੀਸ ਨਹੀਂ ਲਾਂਗੇ, ਅਤੇ ਤੁਹਾਨੂੰ ਕੁਛ ਨਾ ਕੁਛ ਦੇ ਕੇ ਭੇਜਾਂਗੇ, ਤੁਹਾਡੇ ਨਾਲ ਪ੍ਰੋਮਿਸ ਹੈ। ਅਗਲੇ ਵਾਰੀ ਤੁਸੀਂ 200 ਨੇ 500 ਨੇ ਆਉਣਾ ਇੱਥੇ, ਅਤੇ ਇਹ ਮੇਰਾ ਪ੍ਰੋਮਿਸ ਹੈ, ਕਿਉਂਕਿ ਮੈਂ ਇਹ ਪ੍ਰੋਮਿਸ ਆਪਣੀ ਟਰਸਟ ਦੇ ਆਧਾਰ 'ਤੇ ਕਹਿ ਸਕਦਾ। ਤੁਸੀਂ ਇਹ ਸੋਚ ਸਕਦੇ ਹੋ ਵੀ ਟਰਸਟ 'ਤੇ ਮੈਨੂੰ ਕਿੰਨਾ ਵਿਸ਼ਵਾਸ ਹੈ। ਮੇਰੀ ਟਰਸਟ ਇੰਨੇ ਖੁੱਲ੍ਹੇ ਨਾਲ ਹੈ ਵੀ ਤੁਸੀਂ ਬੱਚਿਆਂ ਲਈ ਕੁਛ ਵੀ ਕਰੋ, ਐਜੂਕੇਸ਼ਨ ਲਈ ਕੁਛ ਵੀ ਕਰੋ। ਪ੍ਰਧਾਨ ਜੀ ਮੈਨੂੰ ਡੇਲੀ ਕਹਿੰਦੇ ਆ ਐਜੂਕੇਸ਼ਨ ਲਈ ਪ੍ਰਧਾਨ ਜੀ ਕੋਲ ਚਲਾ ਜਾਵੇ। ਅਸੀਂ ਇੱਥੇ ਸਾਰੇ ਬੱਚਿਆਂ ਦੀ, ਤੁਸੀਂ ਹੈਰਾਨ ਹੋਵੋਗੇ, ਸਾਡੇ ਕੋਲ ਕੁੜੀਆਂ ਨਰਸਿੰਗ 'ਚ ਕੰਮ ਕਰਦੀਆਂ, ਜੇ ਕੋਈ ਬੱਚਾ ਫੀਸ ਨਹੀਂ ਭਰ ਸਕਦਾ ਅਸੀਂ ਪ੍ਰਧਾਨ ਜੀ ਕੋਲ ਰਿਕੁਐਸਟ ਕਰਦੇ ਹਾਂ, ਉਹਦੀ ਅਸੀਂ ਬੱਚਿਆਂ ਦੀ ਫੀਸ ਮਾਫ ਕਰ ਦਿੰਦੇ ਹਾਂ। ਜੇ ਅਸੀਂ ਕਹਿੰਦੇ ਹਾਂ ਵੀ ਕੋਈ ਬੱਚਾ ਅਸੀਂ ਪੜ੍ਹਾ ਦਈਏ ਤਾਂ ਸਾਡੇ ਲਈ ਸਭ ਤੋਂ ਵੱਧ ਚੀਜ਼ ਇਹੀ ਹੈ। ਇਸ ਕਰਕੇ ਅਸੀਂ ਇਹੀ ਕੋਸ਼ਿਸ਼ ਕਰਦੇ ਹਾਂ, ਕੋਈ ਬੱਚਾ ਤੁਹਾਡੇ ਕੋਲ ਗਰੀਬ, ਅਸੀਂ ਹੁਣ ਵੀ ਐਸੇ ਮੰਚ 'ਤੇ ਕਹਿਣਾ ਚਾਹੁੰਦਾ ਮੈਂ, ਜੇ ਕਿਸੇ ਨੂੰ ਕੋਈ ਗਰੀਬ ਬੱਚਾ ਫੀਸ ਨਹੀਂ ਦੇ ਸਕਦਾ, ਅਸੀਂ ਉਹਦੀ ਮਦਦ ਕਰਨ ਨੂੰ ਤਿਆਰ ਹਾਂ। ਨੈਕਸਟ ਈਅਰ ਦੇ ਵਿੱਚ ਉਹ ਸਾਡੇ ਕੋਲ ਆਵੇ, ਅਸੀਂ ਕਿਸ਼ਤਾਂ 'ਚ ਪੈਸੇ ਲੈ ਲਾਂਗੇ, ਕਿਵੇਂ ਵੀ ਕਰਾਂਗੇ, ਬਟ ਉਹਨੂੰ ਪੜ੍ਹਾਉਣਾ ਹੈ। ਅਸੀਂ, ਸਾਡਾ ਇੱਕੋ ਹੀ ਮਕਸਦ ਹੈ ਕਿ ਸਾਡੀ ਐਜੂਕੇਸ਼ਨ ਟਰਸਟ ਦਾ ਇੱਕੋ ਮਕਸਦ ਹੈ ਕਿ ਸਾਰੇ ਬੱਚਿਆਂ ਨੂੰ ਅਸੀਂ ਐਜੂਕੇਟ ਕਰੀਏ। ਇਸ ਕਰਕੇ ਮੈਂ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਇੱਥੇ ਆਉਣ 'ਤੇ ਥੈਂਕਸ ਕਰਦਾ। ਨਾਲ ਹੀ ਮੈਂ ਤੁਹਾਨੂੰ ਹੁਣ ਬੇਨਤੀ ਕਰਦਾ ਕਿ ਆਪਣੀ ਟੀ ਤਿਆਰ ਹੈ, ਆਪਾਂ ਸਾਰੇ ਚਾਹ ਪੀ ਕੇ ਉਸ ਤੋਂ ਬਾਅਦ ਅਗਲਾ ਆਪਾਂ ਸ਼ੁਰੂ ਕਰਾਂਗੇ। ਥੈਂਕ ਯੂ।
Thank you so much, sir, for motivating us. Now it's tea time, and to boost up your energy, let's gather to have some tea and snacks, and please get reassembled here before 11:50 a.m. Thank you so much, everyone, and enjoy your high tea.
नहीं ले जा ला दे शॉट दी जा के ਚੱਲਦਾ ਆ ਬਸ ਠੀਕ ਹੈ
ਹਾਂ ਰੈਸਟ ਓਕੇ ਓਕੇ ਹੁਣ ਇਹਦੇ ਗਰੀਨ ਨਹੀਂ ਚੱਕ ਹੋਣੇ ਉਹਦੇ ਗਰੀਨ ਨਹੀਂ ਚੱਕ ਹੁੰਦੇ ਹੈਗੇ ਹੁਣ ਅੰਦਰ
सर कॉपी
ठीक है
स्टैंड च लोड़ ही नहीं अद्धे घुमा के वो तो उत्थे ला दूंगा ना
ले आओ फिर भी कोई ਉੱਥੇ ਲਾ ਕੇ
जिला तेरा हाथ ਦੇਖੋ ਵੀਰੇ ਸਾਈਡ ਦੀ ਚੱਲ ਨਿਕਲ ਜਾ ਸਾਈਡ
कॉफी लेनी कि चाय लेनी?
और पासे मारे नहीं वो फिर इसका ठीक पे आना देख के और दूसरा डके ना
स्ट्रॉन्ग कर दी हुई है।
I know that.
ਚਾਹ ਪੀ ਲਵਾਂਗੇ A very good afternoon to everyone, especially the dignitaries. And first of all, I would like to thank to inviting me as a speaker over here. I'm going to present my topic is automation in a medical industry. So first of all, everyone please sit down. And first I would like to ask, are you comfortable with English or Hindi or mix? I can't hear. Mix. Okay. So before going to start, I would like to say that automation is the future. Everybody agree with that? Automation is the future. Everybody knows that today's world is going through the automation. Everybody knows that in present time, many industries are going through the automation, like you have seen the driverless cars and driverless equipments and robotic surgery even. So we in a medical industry, we also focus on automation, and it would like to, it will help us to improvise a medical industry, medical science, diagnostics, surgeries, treatments. Okay. So first we will discuss what is automation, what we call automation. And automation is something like a thing we can done without a human effort, right? Like it is a technology, you can say, by which a process or procedure is performed without a human assistance. And in clinical laboratory, it is defined as a process by which analytical instruments perform many tests with least involvement of analyst. There is basically two types of automation, like semi-automated and fully automated. Most of the clinical laboratory students have seen that. How many of you are clinical laboratory students, MLT or MLS? Very less. And how many of you are from radiology technology? Okay. So most of you aware about the automotive, like CT, MRI, देखा होगा आप लोगों ने. कभी सोचा है कि अगर हम रेडियोलॉजी में ऑटोमेशन का यूज़ नहीं करते, सपोज MRI में, then how it will be possible to get a internal picture of patient? कैमरे से तो नहीं ले सकते थे. We can't use microscope even, right? जैसा अभी पहले सर ने बताया कि you cannot take examination of elephant through the microscopy, right? So we will discuss about the both of the technique, like semi-automated and fully automated. Now, what are the role of automation in medical industry? What kind of things we can get through automation? Like computer technology is widely used throughout the medical field, and computers are used for everything, from testing products to determine the safety and effectiveness of new drugs. Even the testing drugs, like medical laboratory, use the computer technology to test thousands of different drugs before implementing to the patients. Running simulation, most of the nursing students knows about the simulation. Simulation is the very, very important part of the medical industry. With an example, I can explain you. Suppose you have a, you don't have an aeroplane, but you have to learn the, how to play the aeroplane. Even you don't have a car, but you want to learn about how to drive. Same, you want to learn about the surgery without a patient. अगर आप कोई सर्जरी सीखना चाहते हैं, सपोज आप कुछ भी सीखना चाहते हैं, बट यू डोंट हैव द एसेट्स, यू डोंट हैव द मटीरियल, दैट टाइम सिमुलेशन कैन हेल्प यू. It will allow you to feel the exact environment. It will allow you to feel the exact pressure. जो भी प्रेशर सर्जरी के दौरान आता है, जो भी प्रेशर आपको ड्राइविंग के दौरान आता है, ये चीज़ आपको पहले से ही एक्सप्लेन कर देगा, पहले से ही आपको फील करा देगा. सपोज यू आर सिटिंग इन अ चैम्बर वेयर यू हैव टू ड्राइव अ कार, यू विल फील एग्जैक्टली. आपने देखा होगा वीडियो गेम्स में, मूवीज़ वगैरह में, या मॉल्स में भी आजकल अवेलेबल है. तो बाइक्स वगैरह पे राइडिंग करते हुए एग्जैक्ट फील आपके सामने एक स्क्रीन रहता है और आप फील करते हैं कि यू आर राइडिंग अ बाइक, यू आर ड्राइविंग अ कार। सेम टाइप यूज़ होता है मेडिकल इंडस्ट्री में, सिमुलेशन हम उसको बोलते हैं। लाइक यू आर यूजिंग अ डमी आपने देखा होगा, नहीं देखा है? एनर्जी डाउन हो गई है लगता है बच्चों की काफ़ी डाउन हो गई है। यू डोंट हैव डमी इन योर कॉलेजेस? डमी नहीं देखी है? देखी है ना? यू डोंट हैव मोडालिटीज, यू डोंट हैव इंस्ट्रूमेंट्स इवन देखे होंगे आप लोगों ने, आपके टीचर्स सिखाते होंगे हाउ टू यूज द इंस्ट्रूमेंट, हाउ टू यूज द डमीज टू एग्जामिन द पेशेंट, राइट? एग्जैक्टली पेशेंट को तो नहीं लेटाते हैं ना काउच पर, डमीज रहती हैं। सेम टाइप सिमुलेशन कैन यूज टू एक्सप्लेन, टू ट्रेन द टीचर्स, इवन स्टूडेंट्स, to how to use, how to tackle a exact situation, right? Now third point where we use the automation is in a blood work, where the taking blood samples and analyzing the results in an important part of the medical lab. So sophisticated computer technology can quickly determine the levels of protein, amino acids, sugars and other elements from the blood sample, and they are used to generate results that are sent back to the patient's physician. Like आप लोगों ने when we talk about the early 90, 40 or 50 or 60, 65, that time we don't have autoanalyzer, we don't have fluorescent microscopy, we don't have automated things like CBC, Coulter counter, हम लोगों के पास नहीं था। जैसे CBC अगर कंप्लीट ब्लड काउंट करना है, वी हैव टू मेक द स्मीयर, देन आफ्टर मेक स्टेन, देन आफ्टर वी हैव टू यूज द माइक्रोस्कोपी, एंड बहुत एक्सपर्टीज लगती थी टू काउंट द सेल, टू एग्जामिन द सेल, टू आइडेंटिफाई द सेल। बट नाउ डेज वी जस्ट हैव टू टेक द सैंपल एंड एस्पिरेट इन अ CBC Coulter काउंटर, एंड देन आफ्टर वी विल गेट द रिजल्ट ऑटोमेटिकली। देखा होगा आपने कभी स्मीयर वगैरह देखा है, ब्लड पिक्चर देखा है? तो अगर सिंपली ब्लड पिक्चर आपको बनाना पड़े तो काफ़ी एफर्ट लगता है, एंड देर आर लॉट्स ऑफ चांसेस टू हैव एरर, काफ़ी उसमें दिक्कत आती है। स्टेन कभी प्रॉपर नहीं हुआ है, कभी आपका स्मीयर नहीं बन पा रहा है। इवन एग्जामिनेशन में भी आपको बहुत एक्सपर्टीज देखनी पड़ती है, हाउ टू आइडेंटिफाई द सेल, डिफरेंट काइंड ऑफ ब्लड सेल्स एंड क्वांटिटी, राइट? बट नाउ डेज वी हैव अ Coulter counter, we have a CBC cell counter, we can use, and within a 2 minutes we will get the result with 22 or 25 parameters, right? So there it will help with the help of automation. Now generating a research data, this particular point is for our research scholars, that automation can also help to generate the research data. Recently a word can published ChatGPT. Anybody aware about that particular word, ChatGPT? This is the advanced version of AI, which we call also automation, which will be also useful in a research. Like in medical lab, tons of patients record can be presented in a computer on a usable format, and information from a patient outcomes to the result of a drug testing can be used in generating research data on computer. Then after we will also use the analyzing patient data. Like for an example, you have a different flow of patients. जैसे कि आपके पास suppose we will talk about the radiology, आपके पास एक्सरे के बहुत पेशेंट्स आए हैं, सपोज डेली आपके पास 100 पेशेंट आते हैं, ठीक है? तो विदाउट एन ऑटोमेशन यू कैन नॉट एनालाइज ईच एंड एवरी पेशेंट इन अ सिंगल चार्ट, ठीक है? आप एक एक पेशेंट को देख सकते हैं कि हाँ भाई किसी को चेस्ट एक्सरे कराना है, किसी को नी एक्सरे कराना है, किसी को फुल बॉडी एक्सरे कराना है, बट एट द एंड अगर आप जानना चाहते हैं कि कितने पेशेंट हमारे पास एक्सरे के आ रहे हैं, कितने पेशेंट हमारे पास नीज के आ रहे हैं, आप एक डेटा जनरेट करना चाहते हैं कि किस तरह का पेशेंट फ्लो हमारे इंस्टीट्यूशन में, हमारे हॉस्पिटल में है, दैट टाइम दिस ऑटोमेशन विल हेल्प यू. दिस ऑटोमेशन विल गिव यू द एग्जैक्ट रिजल्ट दैट इतना पेशेंट आपका नी का है, इतना पेशेंट आपका चेस्ट का है, इतना पेशेंट आपका टीबी का है, अदर डिजीजेस का है. उसके अकॉर्डिंगली यू कैन इम्प्रोमाइज योर डिपार्टमेंट, उसके अकॉर्डिंगली यू कैन इम्प्रोमाइज योर ऑल द सब्जेक्ट्स. नाउ दिस इज द न्यू थिंग which will be used in a laboratory system, we can say intelligent laboratory information system. In this, lists are a critical component of the operation of a clinical laboratories. I will explain you in a simple manner. This system will help diagnostic team, this system will help physician, this system will help the patient as well. It is a system which will be connected or interface between patient, physician and the diagnostic system. Simple manner है कि एक सॉफ्टवेयर है जहाँ पर पेशेंट एंट्री करता है, आप उसको एक रजिस्ट्रेशन आईडी देते हैं या पेशेंट आईडी देते हैं, ठीक। उस पेशेंट आईडी को हम लोग एक तरह से पूरे डिपार्टमेंट में फैला देते हैं. अ फिजिशियन हैव दैट पर्टिकुलर आईडी, लेबोरेटरी डायग्नोस्टिक डिपार्टमेंट हैव दैट पर्टिकुलर आईडी, और पेशेंट को भी वो आईडी है, एंड विद द हेल्प ऑफ इंटरनेट ही विल गेट हिज रिजल्ट एट हिज होम. उसको बाहर जाने की ज़रूरत नहीं है, उसे हॉस्पिटल जाने की ज़रूरत नहीं है फॉर गेटिंग अ रिजल्ट, राइट. With the help of this system, you can discuss the critical situation or a problem with the another expert from another university or another state or another country. इस सिस्टम की मदद से आपको कहीं रिपोर्ट भेजने की ज़रूरत नहीं है. You just have to send the ID to the expert, and expert will get all the details of the patient, and he will suggest all the suggestion or therapy or a diagnosis to the patient or the concerned physician also, right. Now the categories of laboratory information system, where will information manager will work, healthcare provider can have their technical staff, manager, laboratory director and patients. They all can get the benefit from this particular system, this particular software. This kind of software mostly used in a super specialty or multi-specialty hospital, where they have to tackle lots of tons of patients in each and every day. So it is very hectic to manage all the patients. That time this automation can help to manage the patient in a very safe way. Now these are the useful information associated with reagents and other test components, where this LIS system can work on the platform of these things, where you have to mention the name of the component, manufacturer, if we're talking about that medicine or reagents or something else, where you have to put the catalog number, lot number, date, time, initial volume, current volume, expiration date and storage requirement. तो दिमाग में एक क्वेश्चन आ रहा है ना कि ये सब चीज़ें क्यों लिखना है, ये सब चीज़ों का इंफॉर्मेशन हमें क्या हेल्प करेगा. This will help to tackle the situation, this will help to track the problems, this will help to, देखिए आपके पास कोई रिएजेंट आता है, या सपोज कोई ड्रग्स आता है, या सपोज कोई डायग्नोस्टिक मटेरियल आता है, ठीक है. हम लोग अच्छे हॉस्पिटल की अगर बात करें, बेस्ट हॉस्पिटल की बात करें, तो वी विल टेक क्वालिटी कंट्रोल फॉर दैट पर्टिकुलर रिएजेंट और द मटेरियल्स, राइट. उनका क्वालिटी कंट्रोल करते हैं, बट उसके बाद भी जो प्रोबेबिलिटी है वो 99%, 98%, 95% है. देयर इज़ अ लूप होल ऑफ 5%, राइट. उसके बाद भी ज़रूरी नहीं है कि वो आपका सब्जेक्ट या वो चीज़ सही है. इवन देयर इज़ अ क्लैरिकल एरर, ये भी एक प्रॉब्लम हो सकता है कि आपका लिखा पढ़ी में कुछ गड़बड़ी हो जाए, ठीक. या फिर इसके बाद एनालिटिकल प्रॉब्लम भी हो सकता है, आपसे गलती हो जाए, आपने किसी को बताया नहीं. तो अगर हम चाहते हैं कि हम ट्रैक कर सकें कि कहाँ पर प्रॉब्लम है, वहाँ पर ये चीज़ बहुत इंपॉर्टेंट हो जाती है कि भैया क्या लॉट नंबर था, कब आया था, किसने रिसीव करा था, उसका क्वालिटी चेक हुआ कि नहीं हुआ, एंड ईच एंड एवरीथिंग शुड बी इन अ रिटर्न. दैट्स वाई वी टॉक अबाउट द ऑटोमेटिव सिस्टम. आपको कंप्यूटर में इसकी डेटा एंट्री करनी पड़ेगी. डेटा एंट्री करने के बाद ये सबके पास डिस्ट्रीब्यूटेड रहेगा, सो दैट यू कैन बी easily track that particular problem, right. We can use automative system in a data mining and a cross-sectional reports, which will give us to ability to perform queries in the laboratory and clinical database is significant to maximize the efficiency and quality of the laboratory operation. It also provides means of identifying clinical issue affecting a specific population. It performs epidemiological and public health studies and case finding for the clinical and research purpose, like this corona period. सबने देखा है ना ये कोरोना पीरियड 2 साल का, देखा है ना, बहुत प्रॉब्लम हुई थी. इवन यू पीपल्स ऑल्सो अवेयर अबाउट द ऑनलाइन एजुकेशन. देखा था, इट कैन बी बेटर विद द हेल्प ऑफ ऑटोमेशन. आपने देखा होगा कुछ यूनिवर्सिटीज़ ने अपना खुद का ही प्लेटफॉर्म बनाया हुआ था फॉर टीचिंग पर्पस इन ऑनलाइन प्लेटफॉर्म, बट कुछ लोगों ने जूम और सम अदर एप्स यूज़ करे थे. So there is a huge difference between these particular apps and the specialized app made by the university and made for the university like Blackboard and other. तो आप अगर अवेयर हैं इसके बारे में तो आपको खुद ही पता चल गया होगा कि ऑटोमेशन में कितना पावर है, राइट? Now advanced data warehouse and mining capability should be available in an advanced LIS system, like example of useful queries and reports including the following. Like search combination of the lab result with diagnosis, medications and treatment using a Boolean logic, and producing report with user-friendly display of queried and non-queried field like patient's demographics, specimen accession number and location. Such reports should be exportable to Excel sheet for further analysis. Lab testing turnaround time reports would be with the ability to consolidate or split various components like order to collection and collection to receipt to testing to report including individual test or test group, hours and shift, employees, patient location, clinic, providers, etc. and so on. Now surveillance data reporting to public health agencies required in a standard format. Laboratory utilization report by the provider, specialty, clinics, wards, patient types, diagnosis and diagnostic groups, test type, volume and cost per cases. Patient's outcome analysis using laboratory data mining capabilities and clinical data extracted from the HIS. Now we can use automative system in a bioelectric signaling, like for the example ECG, EEG, EMG, EOG. Everybody aware about these names? Can anyone explain what is the full form EEG? Radiology, I'm asking to you. सब फर्स्ट ईयर के हैं. EEG का फुल फॉर्म What is ECG? Okay. What is EMG? Yes. Electromyography. And what is EOG? क्या हो गया रेडियोलॉजी? ये तो बेसिक है, ये तो आपका काम का पार्ट है. Electro. Okay, now the automation in cytology. This is the very hardest part of the diagnostic industry. Cytology, examination of the cytology, right? Despite manual screening, some faults do exist, prompting development of viable automated system. Cytology is a science concerned with the structure and function of the plant and animal cell, where automation in cytology started and was focused for a long time on a pap smear. Later, a pap smear were applied to broader area of a cytology. Now, जिनको पैप स्मीयर नहीं पता है वो जान लें what is pap smear. Pap smear requires a sample of a cell collected from the cervix for testing. Mostly it is a staining procedure which will be helped to diagnose the cancerous cell or tissues. Okay, and the first attempt to automate the screening of a cervical smear was in the 1950s, where Mallows and co-workers developed a scanning device which we called cytoanalyzer. And this particular device is an electronical optical apparatus for the detection of malignant cells in a smear. It helps to collect data on nuclear size and nuclear optical density of the large number of cells, and the process was slow due to lack of computers. Now later in 1990s, an improved technique of pap smear called thin prep was introduced, which is approved by FDA. And then after clinical trials confirmed increased sensitivity compared to the conventional pap smear, this helped in saving lot of money and unnecessary recall visit and negative colposcopic examination and biopsies. Colposcopy क्या होती है? It is a medical diagnostic procedure to examine a illuminated magnified view of the cervix. So most of the people are, affecting by the cervical cancer, these kind of, cancer of cervix. This kind of cancer can be diagnosed only through the cytological smear preparation or the microscopy, you can say. तो इसमें काफ़ी टाइम जाता था. एक चीज़ मैं बोलना चाहूँगा, in pathology, diagnosis is easy, but some kind of disease can be very hard to diagnose, like especially if we talk about the cancer. Most of the cancers are very, very difficult to diagnose or differentiate, like leukemia, lymphoma, myeloma, and most of the cancers like cervical cancer, which will be happen, increase day by day, like 72%, patient having a cancer, in 72% people are having a breast cancer, right? So females should be aware about that thing, ठीक है? तो वहाँ पर आपका cytology बहुत use होता है to diagnose that particular cancer. Now, what is the need of automation? We again discuss about this thing. Failure to detect the abnormalities in the cell during a screening was major challenge faced in many cases. Many errors in reports occurs due to overlapping of a cell and a nuclei and obscuring factors. Automated instrumentation may improve sensitivity, reduce unsatisfactory specimen, and increase turnover rates. That's why we need automation. Now, what are the goals of the automation? To improve the accuracy of the test result, to shorten the length of the time need to perform test, obtaining a slide that is representative of original sample collected from the patient, rapid, reliable, and reproducible screening. The system should be able to send alert on a smear adequacy, and the system should select suspected cell slide for the cytologist to obtain final outcome. This one is the picture of a thin prep processor where we can easily use a smear procedure to diagnose the cervical cancer and problems of the cervix. These are the references you can use. And last, thank you everyone to inviting me here. Is there any question to anyone? No. Thank you.
Thank you, sir, for your knowledgeable presentation. A big round of applause for Dr. Vikas Tiwari. Now, I would like to invite our director, sir, Dr. Shwinder Singh Gill. Let us welcome him with a huge round of applause.
Thank you very much, madam, inviting me. My dear teachers and my dear students. This is a new branch, allied sciences, paramedical sciences, and you are the perhaps first candidates to be admitted in this course in such a large number. We used to conduct these courses in a small number in PGI, All India Institute. Hardly 2-3 students were taken, and they were not being trained for this type of purpose, but we are trying to do. They were just trained as to be a good technician, not to be teachers, not to be this. Very nice things has been said before me about this course, but I just want to make you aware that you are to go a long way. In the medical science, we have a MCI, that Medical Council, DCI, Nursing Council. Now we are having this allied sciences course. You have to put in a lot of work in it. Everybody should be involved in it. What type of courses we should, how should be the length, what we should teach, and who should teach. There will be challenges that you will not find teachers because this course never runs. MSc is nowhere. PhD is hardly anywhere. And if a PhD student, then there's so many objections by the university, by the UGC and all those things that somebody cannot be guided and there is a problems and all those things. So you are to work collectively, all of you, that how to bring this science at least equivalent to the Nursing Council, which is very strong, number one, very effective, very good education is given, and there is 100% employment if in one course. Medical courses are different from other courses, that is law, engineering, and all. They admit 100 courses, only 10-15% pursue this course, and they go somewhere else. Medical courses are different. If there are 100 doctors pass, 98% will be earning their bread from that course. Similarly true for nursing, true for dental and all those things. But you should be very clear that you have to make these courses very relevant to the society, to the Indian, to the medical profession. So this will be a challenge for all of your faculty, organizations. You have to take help from other organizations like MCI, UGC, Nursing Council, that how they have built such courses. So there is a big challenge before the faculty. This is what I'm saying. Those who are managing these courses, it is not just that you come and you teach, then you go. You have to work very, very hard. When as a Vice Chancellor, as this thing, I am seeing this, it is a very difficult task. And then you have to find a place in the system. Most of the people, when we were devising these courses, that courses should be 4 years, people were saying, no, this should not be, this should be, but over the diploma kar lo. They should be less than diploma, they should be just taught how to take a sample, and we have everything like automation and all those things, so we don't need them. So this barrier has to be broken. Why you people, by training these people, this is your responsibility. And I am thankful to the organization that within 1 year we have organized this function in our college. This is a great achievement. And I am thankful to my organization and to the organizers sitting in front of us. Thank you very much. Yeah.
Thank you so much, sir, for always encourage us for our future. All the speakers are jury members of the future competition. Kindly mark the results in your respective files.
It's time to refresh yourself. So I would like to call GNA University, Phagwara, Punjab, students of GNA University, Phagwara, Punjab, to have their dance performance in front of us. Give a huge round of applause for the students.
लैम्बोर्गिनी ते किथे लाउंदा फिरे गेड़ियां जरियां नी जांदियां फ्रेंडा मैथों तेरियां वे पोटा पोटा पिंजिया पिया हाय पिंजिया जांदा है जिवें रू वे दिल तेरा काला मुंडिया भावें चन्न तो समखा तेरा मुंह वे दिल तेरा काला मुंडिया तेरा बंदरा तू वे दिल तेरा काला मुंडिया भावें चन्न तो समखा तेरा मुंह वे दिल तेरा काला मुंडिया भावें चन्न तो समखा तेरा मुंह
मैं तेरे नालों सोना कोई भी वेख्या ना सूरज तत्ता ते चन्न दागी तारे पत्थर ने कोई मुल नहीं सी था रुड़दे फिरदे सी लोहा पार ला दिता एक चंदन दी लकड़ ने लोहा पार ला दिता एक चंदन दी लकड़ ने बातें लिखिया नाले वेखा नाले चुम्मा मैं मेरी सुरत भुलाती तेरे नां दे अखर ने मेरी सुरत भुलाती तेरे नां दे अखर ने
एक रंग सावला तेरा नी तो जुल्फा पाया केरा नी डेंजर तेरी अख कुड़े जिवें तालिबान दा डेरा नी एक रंग सावला तेरा नी तो जुल्फा पाया केरा नी डेंजर तेरी अख कुड़े जिवें तालिबान दा डेरा नी 5 दिन कुड़ी पाके रखे सारा वीकेंड पाउंदी सूट पटियाला 5 दिन कुड़ी पाके रखे सारा वीकेंड पाउंदी सूट पटियाला कैंडल लाइट मेरा दे वादे करके सुनी सुनी चन्ना तेरे कैंडल लाइट मेरा दे वादे करके सुनी सुनी चन्ना तेरे लारे मर गए हाथ गिराउण लई बड़े पानी भरे तू ना अज कल साडे नेड़े तेरे खड़े तू वे मैं झूठ ना है सही सजना वे तू सिद्धा सिद्धा मेरे नाल निबड़िया कर ये मैं प्यार नाल रहिंदी सजना ना तू बिगड़िया करी ना तू बिगड़िया करी ये मैं प्यार नाल रहिंदी सजना ना तू बिगड़िया करी ना तू बिगड़िया करी ये मैं प्यार नाल रहिंदी सजना ना तू बिगड़िया करी ना तू बिगड़िया करी पन खट लेनी मित्रा दी कोई भी नहीं ऐसी वारदात साडे नाल होई भी नहीं पूरा असले दी नौक ते नचाइयां नहीं कदे बिल्लो जट दी ज़मीर इन्नी मोई भी नहीं तू हाँ कर देनी जोड़ी साडी टक्कर दी नी टक्कर दी ओ की पता खौरे जून सुधर जाए टक्कर दी नी फक्कर दी की पता खौरे जून सुधर जाए टक्कर दी नी फक्कर दी की पता
Wow. What an outstanding performance it was. A big round of applause for the students of GNA University. की सिफ्त करा पंजाबना दी की सिफ्त करा पंजाबना दी पंजा पानिया दा इना उत्ते नूर लोको की सिफ्त करा पंजाबना दी पंजा पानिया दा इना उत्ते नूर लोको पैण धमका जिथे भी पवे भंगड़ा पैण धमका जिथे भी पवे भंगड़ा जग जानदा ए गल जरूर लोको जग जानदा ए गल जरूर लोको हुण तुहाडे सामने गुरु नानक पैरामैडिकल कॉलेज दीआं विद्यार्थियां पंजाब दा प्रसिद्ध लोक नाच भंगड़ा पेश करन जा रहीआं आओ उन्हां दा जोरदार ताड़ियां दे नाल स्वागत करिए।
ਅੱਜ ਮੇਲੇ ਹੋ ਗਏ ਸੱਜਣਾ ਲੱਗੇ ਗਮ ਵੀ ਦਿੱਤੇ ਹਰਾ ਮੇਰੇ ਚਿੱਤ ਨੂੰ ਕੰਬਣੀ ਛਿੜ ਗਈ ਤੈਨੂੰ ਦੇਖਿਆ ਜਦੋਂ ਜ਼ਰਾ ਸਾਨੂੰ ਸਾਰਾ ਹੀ ਜੱਗ ਵੇਖਦਾ ਹਾਂ ਮੇਰੇ ਹਾਣੀਆਂ ਸਾਨੂੰ ਸਾਰਾ ਹੀ ਜੱਗ ਵੇਖਦਾ ਤੇਰਾ ਕਿੱਦਾਂ ਹੱਥ ਫੜਾਂ तिजोरियां आले फड़ कुंजियां ते सांभल तिजोरियां खसमां नू खांदा तेरा घर वे चल मेले नू चलीए हो रौनक हो जू घट वे चल मेले नू चलीए चल मेले नू चलीए ਲੱਕ ਨਾਲ ਠੁਮਕਾ ਜੇ ਲਾਉਣਾ ਨਹੀਂ ਜਾਣਦੀ ਢਾਲ ਵਿੱਚ ਗਿੱਧਾ ਜੇ ਤੂੰ ਪਾਉਣਾ ਨਹੀਂ ਜਾਣਦੀ ਲੱਕ ਨਾਲ ਠੁਮਕਾ ਜੇ ਲਾਉਣਾ ਨਹੀਂ ਜਾਣਦੀ ਉਹ ਬੋਲੀ ਪਾ ਕੇ ਬੋਲ ਜੇ ਤੈਨੂੰ ਚੱਕਣਾ ਨਹੀਂ ਆਉਂਦਾ ਤੂੰ ਕਾਦੀ ਪੰਜਾਬਣ ਜੇ ਤੈਨੂੰ ਨੱਚਣਾ ਨਹੀਂ ਆਉਂਦਾ ਤੂੰ ਕਾਦੀ ਪੰਜਾਬਣ ਜੇ ਤੈਨੂੰ ਨੱਚਣਾ ਨਹੀਂ ਆਉਂਦਾ ਸ਼ੇਪ ਦੀਆਂ ਬੁੱਲੀਆਂ ਤੇਰੇ ਅੱਗੇ ਸੰਗ ਦੀਆਂ ਨਹੀਂ ਉਹ ਖੁੱਲੀਆਂ ਨਿੰਮ ਦੇ ਪੱਤੇ ਦੀ ਸ਼ੇਪ ਦੀਆਂ ਬੁੱਲੀਆਂ ਤੇਰੇ ਅੱਗੇ ਸੰਗ ਦੀਆਂ ਨਹੀਂ ਉਹ ਖੁੱਲੀਆਂ ਹੋ ਗੋਰੇ ਗੋਰੇ ਰੰਗ ਉੱਤੇ ਚੁੰਨੀ ਅਸਮਾਨੀ ਜਦੋਂ ਲੈਂਦੀ ਖੋਲ ਕੇ ਉਹ ਬੋਝਲਾ ਸ਼ਕੀਨਾ ਆਪੇ ਗੱਲ ਦਿਲ ਦੀ ਵੇ ਕਿਵੇਂ ਦੱਸਾਂ ਬੋਲ ਕੇ ਬੋਝਲਾ ਸ਼ਕੀਨਾ ਆਪੇ ਗੱਲ ਦਿਲ ਦੀ ਵੇ ਕਿਵੇਂ ਦੱਸਾਂ ਬੋਲ ਕੇ ਮੈਂ ਤੇਰੇ ਨਾਲੋਂ ਸੋਹਣਾ ਕੋਈ ਵੀ ਵੇਖਿਆ ਨਾ ਸੂਰਜ ਤੱਤਾ ਤੇ ਚੰਨ ਦਾਗੀ ਤਾਰੇ ਪੱਥਰ ਨੇ ਕੋਈ ਮੁੱਲ ਨਹੀਂ ਸੀ ਥਾਂ ਥਾਂ ਰੁਲਦੇ ਫਿਰਦੇ ਸੀ ਲੋਹਾ ਪਾਰ ਲਾ ਦਿੱਤਾ ਇੱਕ ਚੰਦਨ ਦੀ ਲੱਕੜ ਨੇ ਲੋਹਾ ਪਾਰ ਲਾ ਦਿੱਤਾ ਇੱਕ ਚੰਦਨ ਦੀ ਲੱਕੜ ਨੇ ਬਾਂਹ ਤੇ ਲਿਖਿਆ ਨਾਲੇ ਵੇਖਾਂ ਨਾਲੇ ਚੁੰਮਾ ਮੈਂ ਮੇਰੀ ਸੁਰਤ ਭੁਲਾਤੀ ਤੇਰੇ ਨਾਂ ਦੇ ਅੱਖਰ ਨੇ ਮੇਰੀ ਸੁਰਤ ਭੁਲਾਤੀ ਤੇਰੇ ਨਾਂ ਦੇ ਅੱਖਰ ਨੇ ਜਿਹਦੇ ਹੇਠ ਘੋੜਾ ਮੋਢੇ ਤੇ ਦਨਾਲੀ ਨੀ ਪੱਗ ਬੰਨਦਾ ਜੇ ਆਉਣੇ ਮੋੜ ਵਾਲੀ ਨੀ ਉਹ ਜਿਹਦੀ 25 ਪਿੰਡਾਂ 'ਚ ਸਰਦਾਰੀ ਨੀ ਲਾਲੀਏ ਹੋ ਜਾਏ ਵੈਲੀ ਨਾਲ ਯਾਰੀ ਨੀ ਕਹਿੰਦੇ ਡੀਸੀ ਵੀ ਸਲੂਟ ਉਹਨੂੰ ਮਾਰਦਾ ਕਹਿੰਦੇ ਡੀਸੀ ਵੀ ਸਲੂਟ ਉਹਨੂੰ ਮਾਰਦਾ ਪੈਰਾਂ 'ਚ ਥਾਣੇਦਾਰ ਰੋਲਦਾ ਤੂੰ ਨਹੀਂ ਬੋਲਦੀ ਰੇ ਕਾਨੇ ਤੂੰ ਨਹੀਂ ਬੋਲਦੀ ਤੇਰੇ 'ਚ ਤੇਰਾ ਯਾਰ ਬੋਲਦਾ
ਅੱਖਾਂ ਵੇਖ ਕੇ ਨੀਲੀਆਂ ਨਸ਼ੀਲੀਆਂ ਬਲੌਰੀ ਅੱਖਾਂ ਵੇਖ ਕੇ ਨਸ਼ਾ ਇਹ ਜੱਬ ਜਿਹਾ ਚੜ ਗਿਆ ਨੀ ਦਿਲ ਦਾ ਪਤਾ ਨਹੀਂ ਤੇਰੇ ਦਿਲ ਦਾ ਪਤਾ ਨਹੀਂ ਦਿਲ ਦਾ ਪਤਾ ਨਹੀਂ ਤੇਰਾ ਕਿਹੋ ਜਿਹਾ ਹੋਣਾ ਮੈਂ ਤਾਂ ਮੁਖੜਾ ਵੇਖ ਕੇ ਮਰ ਗਿਆ ਨੀ ਦਿਲ ਦਾ ਪਤਾ ਨਹੀਂ ਤੇਰਾ ਕਿਹੋ ਜਿਹਾ ਹੋਣਾ ਮੈਂ ਤਾਂ ਮੁਖੜਾ ਵੇਖ ਕੇ ਮਰ ਗਿਆ ਨੀ
ਉਹ ਸਾਡੇ ਵਾਂਗੂ ਸਾਡੀਆਂ ਨੀ ਉਹ ਬਲੈਕ ਲਿਸਟ ਦੇ ਕਾਰਾਂ ਨੇ ਅਸੀਂ ਅੰਡਰਗਰਾਉਂਡ ਬੰਦੇ ਆਯੂ ਉੱਪਰ ਤੱਕ ਮਾਰਾਂ ਨੇ ਓਏ ਅਸੀਂ ਅੱਜ ਦੇ ਰਾਜੇ ਹਾਂ ਔਰ ਸਾਡਾ ਪਤਾ ਨਹੀਂ ਕੱਲ ਦਾ
DJ Jobin in the mix.
ऑडियंस किद्दां दी लगी परफॉर्मेंस बोल के दसो वधिया या बहुत वधिया ओके a big round of applause for the students of GNA Paramedical College एक कविता पंजाब दियां मुटियारां लई सोनी कुड़िए झोली वालीए सोनी कुड़िए झोली वालीए गल सुन के तू जाई डिग्रियां भावें लखां कर लई डिग्रियां भावें लखां कर लई अणख ना कदे गवाई विच परदेसां पंजाबण पंजाबण खवाई विच परदेसां पंजाबण पंजाबण खवाई Let us back to our main event. Education is the most powerful weapon which you can use to change the world, said by Nelson Mandela. Now, I would like to invite our third speaker, Dr. Jayashree Kanwal Tiwari, Arogyam Institution of Paramedical and Allied Science, Roorkee, Uttarakhand. A big round of applause for Dr. Kanwal Tiwari.
After seeing such outstanding performances, I would like to greet just likewise in your language, Sat Sri Akal. Good afternoon everyone here, good afternoon to delegates, good afternoon to dignitaries and my dear students. Myself Dr. Jayashree Tiwari. I am from Arogyam Medical College, Roorkee, and my place is Dehradun. So I would like to share, or I would like to make aware about the topic, that is physiotherapy management of ankylosing spondylitis. So students, have you ever heard about ankylosing spondylitis? Are you aware of this word? This is a disorder. This is an orthopedic condition, I'll say. Please, I wanted to make an interactive session, moreover interactive session. So are you aware of this word? No? Okay then. So I'm going to make you aware about it. Ankylosing means fusion. What it means? Fusion. Fusion means judna, right? And if we are talking about ankylosing, that means we are talking about fusion of spine. And I hope you know how many vertebrae are there in a spine. Can anybody tell me? 33 vertebrae, right? So more specifically, if I talk about, we have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, sacrum is fused. Then we have 4 pairs of coccyx, right? So we are going to, I'm going to make you aware about what is ankylosing spondylitis. Spondylitis means inflammation, right? So we are going to study, I'm going to make you aware about this topic, inflammation of spine. Moreover, more specifically, that is physiotherapy management of ankylosing spondylitis. Now, prior to that, you should know what is physiotherapy. So students, physio means physical treatment given to the patient. In physical treatment also, we have 2 modes, that is exercise therapy and electrotherapy. So exercise means we are giving the treatment to the patient with the help of innumerable technique of exercises, and in modalities we have innumerable machines, right? So I hope my topic is clear to everyone, what I am going to discuss about. Fine? Please say yes, ma'am. Okay, thank you. Fine. So basically, ankylosing spondylitis is an inflammatory disorder of unknown cause, but then also we have one genetic predisposition, means it is an autoimmune disorder, and for that a gene is involved, that is HLA-B27 gene, right? So it's an autoimmune disorder. It's a idiopathic means cause is still unknown. But then also we can say that if any students from MLT department, they do test, right? You know very well, MLT, how many MLT students are sitting here? Fine. So when you will do test, you will see that HLA-B27 is positive. That means this particular disorder is present in a particular patient, right? Next is rheumatoid factor is absent. If I talk about rheumatoid disorder means it's a joint disorder, and for that a gene that is responsible is HLA-DR4, right? I hope this discrimination is clear to everyone. Fine. Now next is, disease usually begins in the 2nd or 3rd decade of life, and if we compare the ratio of male is to female, that is 3:1 ratio. I hope this is clear, 3:1. Fine. Next. Etiology is unknown, but probable etiologic factors are genetic predisposition, as I have already told you, HLA-B27. Then the bacteria that is involved is Klebsiella, pneumonia, and some other enterobacteria. If I talk about pathogenesis, so I hope you know about pathogenesis. Patho means what? Patho means any abnormality or a disease. How the pathogenesis is done for this particular condition, right? So it is immune mediated and autoimmunity to the cartilage, that is proteoglycan aggregation. So I hope you know what is the basic difference between active and passive structures. How many bones are there in human body? Please buck up, student. How many bones are there? As you are a medical student, you should know these things. 206. And if I talk about how many muscles are there, then total there are 639 muscles in the human body. Out of that, 634 are paired. That means it is on both the sides, that is right side and on the left side. And we have 5 unpaired muscles in the abdominal region. I hope this is clear. Now, if I talk about next thing, that is pathology. As you can see the bold letter, that is enthesis. Enthesis means the site of ligamentous attachment to the bone. As I have already discussed about active and passive structure, so I think you should know that our bones, they are termed to be the active structure, and ligaments, tendon, bursa, many things are there like cartilage, they are considered to be the under the category of passive structure. Means passive structure are those structure they hold our active structure. Fine? Okay then. Next thing is enthesitis. So as the name suggests, enthesitis, wherever the itis is there, that means it is the inflammation. Right? Now next is sacroiliitis. That means it's the inflammation of your spine. Now next. So synovitis means it is the inflammation and it will lead to the pannus formation, and after that fibrocartilage regeneration is there, and after that ossification is there. Means the vertebrae are fused and that will lead to ankylosing spondylitis disorder. Are you getting something? Students, are you getting something? Okay. Now next, enthesitis, osteoporosis. Osteoporosis means when the bone degeneration starts, like when the calcium in our body, it starts degenerating. It occurs at the age of 40 years basically, so it leads to the cracking of bones. So this condition is termed to be the osteoporosis. Then after that, when the calcium level is less, then it can lead to the vertebral fracture as well. Then next, it is spondylodiscitis. That means it is a intervertebral disorder again, which again affects your spine. And last, if I say that ankylosing spondylitis in one word, that means the other name for this disorder is bamboo spine deformity. I hope you know about bamboo plant. Bamboo plant everybody is aware of. So that means our spine, it becomes like a bamboo. Fine? No gaps are there. Our vertebrae are fused. You might have seen many old age people, they are acquiring this posture. So that is what spine are fusing, and it is leading to the disorder, that is your ankylosing spondylitis. So this is the pathology. As you can see, the normal spine, you can see the vertebral disc in between. That blue color disc is in between, right? If we see the advanced ankylosing spondylitis case, that means the disc has been compressed. So are you seeing the comparison between normal and ankylosing spondylitis case? Fine. So if we talk about the symptoms, what are the signs and symptoms for the disorder? So the very first is morning sickness, you can say, or pain in sacroiliac and lower back regions. Buttock pain, I hope you know your buttock area. Are you aware of buttock area? Which is the largest muscle in human body, if I say? Are you aware of it? Buttock means you know very well, right? So we have the most bulkiest muscle, that is gluteus maximus, that is present on your buttock region. And if we talk about smallest muscle, so that is our ear ossicle, that is malleus incus stapes, and the scientific name is hammer, anvil and stirrup. Now the next signs and symptom is lower back stiffness. When the patient wake up in the morning, then patient experience so much pain, right, within 30 minutes. Next is it can lead to chest pain as well, right? You must have heard about angina pain. Angina means pain is originating from the left precordial region of the chest. Next, stiffness and tenderness of the back muscle. Now you are aware of your back. Back is also divided into upper back, mid back and lower back. Next, bilateral sacroiliitis. It can affect on both the sides, as it is spine is involved, so both the lower legs are involved. Next, enthesopathies, that is pain in the site of ligamentous attachment to the bones. Iliac crest. Iliac crest, are you aware of iliac crest? We have a hip bone, and if we talk about the discrimination of the hip bone, so it is categorized like ilium, ischium and pubis. So basically the pain is on the iliac crest. trochanterus of the femur. Femur is the longest bone in the human body. You must be knowing that. Now, spinous vertebra of the spinous processes of the vertebra, costovertebral joints, extra articular manifestation. It involves usually eyes, affection, uveitis. That means inflammation related to the eyes. Then symptoms, pain in the different segments of the spine. Posture, it become like question mark because the vertebrae has been fused. Atrophy of the back muscle, when the muscles will not be used, it will lead to the atrophy of the muscles. Decrease thorax excursion, decrease articulation in the spine. That means there will be no articulation in the spinous processes. Then we have a cutaneous lesion that is involving to the postular psoriasis. And psoriasis is an inflammatory skin disorder, right? That is very advanced, so I'm not going into much detail. Next thing, cardiovascular system involvement. That means the sign and symptom that is related to the heart. Aortitis, that means inflammation of aorta. And you might be knowing that aorta is the biggest vessel that what it does. What is the role of aorta? If you have studied the circulation of heart, you might be knowing about aorta. Aorta distribute oxygenated blood to all the parts of the body, right? Next, we have bronchopulmonary system involvement, then urinary system involvement, then gastrointestinal, that is, it is affecting the GI tract. So this is a question mark posture. That means when a person is affecting from the ankylosing spondylitis, the posture of the patient, it becomes like this. So it is also known as question mark posture, and the other name of the disorder is bamboo spine deformity. Now if we talk about the test, so being a therapist, as I am a physiotherapy expert, we perform certain tests for the diagnosis of this particular condition. The very first test is pelvic compression test, second is Faber test, third is Ganslin test, and the fourth is pump handle test. So if we talk about pelvic compression test, so it's very simple. When the patient is supine lying means when the patient is lying बिल्कुल straight, right? जैसे हम normally लेटते हैं. So what we are doing, what a physiotherapist will be doing, test irritability, they will be compressing the pelvis. And you know very well what is the pelvis area. If you compress that particular pelvis area, if the pain originates, that means the test is positive for this particular ankylosing spondylitis case, right? Next, if we talk about Patrick's test or the Faber test, Faber means flexion, AB means abduction, then we have ER means external rotation. So if I tell you about what is flexion, flexion means if I talk about just normal shoulder joint, we have so many joints in the body, right? So if I talk about flexion, so taking the arm up, that is flexion, right? If I am moving my arm like this, moving away from the midline, that is abduction. If I am moving it towards the midline, that is adduction. And if I am holding the arm like this, that is 90-degree abduction. If I move it like this, that is internal rotation. If I move it like this, so that is external rotation. So same way we have to apply for the hip joint. So this test is performed by having the tested leg flexed, abducted and externally rotated. Are you getting something? What I am talking about? Okay then, next is Ganslin test, next is lab test. So if I talk about lab test, I have already discussed with you people that for this particular condition, HLA-B27 is positive and ESR is what? Erythrocyte sedimentation rate, right? That is also elevated and CRP is also elevated. Mild anemia, that means the hemoglobin level is low. If I talk about the normal level, in some books or many places, the normal range is 12 to 14.44 gram per liter, right? Next is ALP and CPK is raised. If I talk about the treatment for this particular condition, if I talk about the treatment, non-steroidal anti-inflammatory drugs are given to the patient. That means they are painkillers. What does painkiller do? Painkiller is suppressing the pain, right? But on the other hand, we have so many side effects for the painkiller. So then physiotherapy starts and we have so many machines to subside the pain. Like if I talk about TENS, that is transcutaneous electrical nerve stimulation. What it does, this machine particularly, it inhibits the pain by releasing the natural painkillers present in the body, that is endorphins and enkephalin. Right? On the other side, there is an exercise protocol, that is we have to perform at least 40 to 45 minute exercises in order to treat ankylosing spondylitis patients. So that's all for my topic. Thank you so much for inviting here. Thank you so much, everyone.
Thank you so much, ma'am, for your knowledgeable presentation. Give a huge round of applause for Dr. Jayashree Karanwal Tiwari. तो अर्ज किया है, मिटा दे अपनी हस्ती को अगर कोई मर्तबा चाहिए, मिटा दे अपनी हस्ती को अगर कोई मर्तबा चाहिए, कि दाना खाक में मिलके गुले गुलजार होता है. Now, I would like to call the students of Sant Baba Pak Singh University to have their skit performance in front of us. Give a huge round of applause for the students. आप लोगों को ये परफॉर्मेंस? वाओ, व्हाट ए डायनामिक परफॉर्मेंस इट वाज। कहते हैं बारिश ऐसी हो कि समंदर में तूफान आ जाए, कहते हैं बारिश ऐसी हो कि समंदर में तूफान आ जाए, और तालियां ऐसी बजे कि महफिल में जान आ जाए। Now it's time to remove our hunger. So proceed for lunch. So enjoy your meal and energize yourself to enjoy the upcoming event. We will be gathering here again before 2:20 p.m.
अंदर जाना इधर हाँ हाँ इधर ले आई अंदर आ जा आ गया सब्जी चेक कर शाही पनीर मैं छोड़ रहा हूँ लंगर पे कौन दे दे कौन दे प्लेटा च ਉੱਥੇ ਲਾ ਕੇ ਛੱਡ
के करूँगा स्टेज वाल ਨੂੰ स्पीकर ਚੱਲਣ ਲੱਗ ਪਿਆ
students, gather inside the venue so that we can continue with the event. प्लीज स्टूडेंट्स जल्दी वेन्यू में आ जाएं। Good afternoon, everyone. Please take your seat so that we can continue with the event. तो ज़रा गौर फरमाइए, अर्ज़ किया है, महफिल को खूबसूरत बनाने में थोड़ी सी हमारी मदद कीजिए। महफिल को खूबसूरत बनाने में थोड़ी सी हमारी मदद कीजिए। अनजान बनके मायूस नहीं बैठना है, अनजान बनके मायूस नहीं बैठना है। खुलकर मुस्कुराइए और आनंद लीजिए। Thank you, thank you. Proceeding with the event, now let's welcome our fourth speaker, Mr. Abdul Wajid Bhatt, Assistant Professor, GNA University, Fagwada, Punjab. Give a huge round of applause for Mr. Abdul Wajid Bhatt.
A very good afternoon. Hope you all are fine and doing well by the grace of Almighty Allah. Myself, Abdul Wajid Bhatt, currently working as an assistant professor in the Department of Medical Radiology and Imaging Technology at GNA University, Fagwada. First of all, let me begin by welcoming all the dignitaries who are present here, all the faculty members, all the students and speakers to today's event. Also, I am very grateful to my mentor, Mr. Rajdeep Thirwar, for his kind mentorship and support. I am pleased to be invited here on today and speak what I know about the role of artificial intelligence in radiology. So let me start by radiology. What is basically this radiology is? So students from radiology background are aware regarding this thing, that the radiology is that branch of science which deals with various diagnosis. It can be diagnostic purpose, it can be therapeutic purpose. So here in the radiology we are using the various machines, just like we are using the X-rays, we are using the CT machine, we are using the MRI machine, and by the use of these machines we can diagnose. First we diagnose any problem, any disease, and then after that we start treatment of those diseases. After investigation, after detection, so man is to detect the disease. We have to detect it first, then after that the remaining healthcare workers can start the procedure or they can start any treatment. But man is the detection. So the detection of any disease with the help of scanning purpose, it depends upon the radiology. That is why the radiology is considered as the backbone of healthcare sciences. Or we can call, in some books you can get it, that radiology is considered as the heart of the medicine. Because all the things, all the circle of the healthcare sciences, that depends upon the radiology. And here, now my topic is the role of artificial intelligence. This is the new trend in healthcare science, that is artificial intelligence. Till now, you people know we are handling the machine. Operators handle the machine manually with the help of computer system, but we manually type all those things, we manually start the scan, and then after that, after complication of the scan, the radiologists start to diagnose these diseases, to diagnose any problem. But what is artificial intelligence now? Now, another trend is in radiology, that is the artificial intelligence. Work is going on this artificial intelligence, and here you can get it. All the procedures depend upon the radiology, all the investigations, all the diagnosis, they depend upon the radiology. And due to this, the workflow towards the radiology is increasing day by day. The workflow towards the radiology is increasing day by day. The load upon the radiologist is increasing day by day, and that is why we have introduced a method, we have introduced a new technology in this field, that is the artificial intelligence. That is the artificial intelligence. And what is this artificial intelligence? Two branches are there. First one is the machine learning. First one is the machine learning. Machine learning is general. We first machine learning, what is this machine learning? We fix the procedure, we start the procedure, and we give commands to the machine. We give commands to the machine. Then after that the scan starts. But deep learning is the new technology. In deep learning, what we have to do? We have to only start the scan, and then after that machine itself will recognize the diseased tissue, it will recognize any cancerous tissue, and also with the help of various techniques, with the help of various algorithms. What is algorithm? Algorithm is, this is a, you can get it here. Algorithm is a rule, set of rules, or we can call set of procedures, which is fixed inside the machine. Rules are fixed inside the machine, and with the help of these rules, machine can itself diagnose. It can itself differentiate the disease tissue. It can itself differentiate the cancerous tissue from the normal tissue. And then after that, only re-verification is needed by the radiologist. Re-verification is necessary. Re-verification of these diseases is necessary, but determination or diagnosis is done by the machine itself. This is what we call artificial intelligence. This is what we call artificial intelligence. In simple words, we can call, this is a technique. This is a technique by which we train the machine, to do anything. Because we did not only use the artificial intelligence in radiology, but in all healthcare sectors. In all healthcare sectors, we have to train the machine, and then after that, the machine itself will do all those things. It will itself do all those things. And now we will go on towards the slide. In the radiology, artificial intelligence can be used in several ways. We can use the machine learning. We can use the deep learning also. Deep learning is the advanced one. But mostly in the radiology, we are using the deep learning. And what is this deep learning? At deep learning, radiology is using deep learning algorithms for image interpretation, to determination, differentiation of disease, differentiation, or we can call, just like example, we start a scan and several slides are displayed upon the display of the machine, but the machine will itself determine that slide in which any problem is there, in which a disease is there, in which any problem is there. So that is why we are using mostly the deep learning technique in the radiology. We are using deep learning is the advanced one. We are using the deep learning technique in the radiology. And here, next thing is in the recent years, radiology, it is a type of machine learning that uses neural network to analyze large set of data. Large set of data. We get several scans, we get several slices by the machine, and then after that, when we get the several slices from the machine, but the machine itself differentiates. You can get it here, that uses neural network. Radiology, it is a type of machine that uses neural network. Just like in our brain we have neurons, we have a neural network. And with the help of this neural network, we can think, we can do any work, we can differentiate this thing from that thing. And same thing is in the deep learning. And neuron network is there. A set of neuron network is there, and those neuron networks determine itself the phenotype of the human beings also. What is this phenotype? In phenotype feature of the human beings also. That means this deep learning, this technique can determine the eye color of the human beings also. It can determine the eye color. It can determine the various segments, that is the horizontally and also vertically. Also it can determine the blood group of the human beings also. This deep learning is a technique which determines all those things with the help of these algorithms. Several algorithms are fixed here. For each and every disease, separate algorithm is there, separate rule is there, separate technique is there, by which we can determine those diseases, and without the need predefinition by the human expert. We didn't need any human expert who will operate this machine, but we need re-verification. Sometimes there can be a problem in the software. That is why re-verification by the radiologist is necessary. And it is the automatically quantify phenotype features of the human tissue. That means if any cancer is there, will it be malignant or will it be benign? It can differentiate it also. It can differentiate it also because it can differentiate the patterns. It can differentiate the patterns in malignant and in benign. Different patterns are there. So machine itself differentiate those patterns, so it can determine this thing also, that it is a malignant tumor or it is a benign tumor. It is a malignant tumor or it is a benign tumor. And also, next role of the radiology is, it has added benefit of reducing the need of manual processing steps. Manual processing steps is collection of data. First we start scan, we collected the data, and then after that, when we collected the data, we analyze this data. After collection, we analyze. After analyze, a report is framed. A report is framed that this patient is suffering from this problem or that problem. That is the manual collection. Collected data, processed data, and then after that, report frameworking is there. Report frameworking is there by the radiologist. But this artificial intelligence has reduced the burden upon the radiologist. It has reduced the burden upon the radiologist. It itself collects the data, and then after that, it itself processes data, and then after that, next third step is, it self-determines, it self-diagnoses the disease. It itself diagnoses the disease. But this thing is necessary, that re-verification is necessary. Re-verification is necessary. And then after that, AI will assist the technologists also. We people, we are technologists, so it will also assist us. It will also assist us to operate. Because we are the operators, we are operating the machine. It will also help us in operating the machine. In starting the scan, in stopping the scan, in analyzing, it will help us in this way also. AI will assist the technologists in choosing personal patient protocol also. Patient protocol, that is, in simple words, if we talk regarding the X-rays, we can call KVP and MAS. A protocol, exposure factors. Machine will itself fix exposure factors. It will itself fix exposure factors first by determining the phenotype features of the human being. That is the length of the human beings, and then after that, if the patient is fatty, at that time it can easily determine that this patient is fatty, so I have to change the exposure. These things are done by the machine itself with the help of artificial intelligence. Another thing is there, tracking the patient dose by providing an estimation of radiation risk. By this artificial intelligence, we can record the dose of each and every patient. We can record the dose of each and every patient inside the machine, and then after that, we can analyze that dose, that how much dose is absorbed in this patient. This is also the role of the artificial intelligence, that is the determination of absorption dose. How? It will record all those examinations and will record the exposure factors also. By those exposure factors, we can easily calculate the radiation risk, or we can easily calculate the absorbed dose inside the patient, or in simple words, we can call the radiation risk. And next thing is, it can also aid to report workflow and help the linkage between words, image, and quantified data. The artificial intelligence, it can also help us in reporting workflow. How? Because it will first determine the disease. After that, we have to only analyze it. After that, we have to only re-verify it. And another technique is just like RIS is there. RIS, Radiology Information System. With the help of these techniques, we can send our report to another country, radiologist who is present in another country, with the help of teleradiography. On teleradiography, work is going on, and artificial intelligence will be also added in the teleradiography. Artificial intelligence will be added in the teleradiography also, because they have to add the algorithms in this teleradiography. After that, we have to only upload our report, and after 5 minutes, we can get the determination. We can get the diagnosis that this patient is suffering from this or that disease. This patient is suffering from this or that disease. Next thing is clinical application areas of AI in radiology. The main clinical applications. First thing is, that is the thoracic imaging. In thoracic imaging, lung cancer is the one of the most prominent and deadly tumor. You all people are aware regarding this thing, that the lung cancer is the most common and deadly tumor. Lung cancer screening can help identify pulmonary nodules, with earlier detection being life-saving in many patients. If we detect it earlier, if we detect this lung cancer earlier, we can save that patient. We can save that patient. But it is very difficult to determine it. It is very difficult to diagnose it. It is very difficult for the radiologists to detect this nodule blockage or to detect this lung cancer in earlier stage. But this work can be done with the help of artificial intelligence. This work can be done with the help of artificial intelligence. It can determine it in the earlier stage. So with the help of the artificial intelligence, we can save the patient who is suffering from the lung cancer, And the next thing is abdominal and pelvic imaging. In abdominal and pelvic imaging, just like you all people are aware regarding this thing, CT scan is there, MRI is there, that is computed tomography, magnetic resonance imaging is there. So, with the rapid growth in the medical imaging, especially computer tomography and magnetic resonance imaging, more incidental findings, including liver lesions, are identified. AI may aid in characterizing these lesions as benign or malignant. Liver cancer, liver lesions, or we can call liver metas. But AI can differentiate it. Is it malignant or is it benign? Is it malignant or is it benign in earlier stage? By this thing, we can also save the life of various patients. And colonoscopy in colonic polyp that are undetected or misclassified pose a potential risk of colorectal cancer. Although most polyps are identified initially, they can be benign or malignant. In colonic polyps, if any cyst or any polyp is present in the colon, and it is very difficult also to determine it, to diagnose it in the earlier stage, to diagnose or to detect in the earlier stage. But the AI, artificial intelligence, can easily determine it. It can easily determine it. After that, next thing is, if we will determine it in the previous, then at that time we can save the patient. But if it is unable to determine at that time, the benign tumor can become malignant. It can become the cancerous. The friendly tumor can become the cancerous if we didn't determine it in the earlier stage. If we didn't determine in the earlier stage, we can call the friendly tumor. The friendly tumor can become cancerous after some time. So it is necessary to determine it in the earlier stage. So by the help of this artificial intelligence, we can do this thing also. Next thing is, in mammography scanning, screening mammography is technically challenging to expert interpret. AI can assist in the interpretation in parts by identifying and characterizing microcalcification, small deposition of calcium inside the breast of the females. We can determine it. It is also challenging for the radiologist to determine it in the previous stage. So with the help of the artificial intelligence, we can also determine this thing. And we can protect the females from the breast cancer. We can save the females from the breast cancer also with the help of this artificial intelligence. And next thing is the man, that is the brain imaging. Brain tumors are characterized by abnormal growth of tissue and can be benign, malignant, primary or metastatic. AI could be used to make diagnostic predictions. Also in brain imaging, it can also determine, it can also give us the proper determination or proper diagnosis of the disease. And the next thing is, that is the conclusion. Additionally, we can call, it can be used to help manage the enormous amount of medical data generated by the medical imaging. We can, with the help of this, we can manage the large set of data, because nowadays we are using the digital system, we are using the digital radiography system, and the speed of the workflow is more. So with the help of this, there is a lot of burden upon the radiologist, but it can help us to manage that burden. Upon the radiologist, because it can differentiate the data with the help of segmentation. With the help of segmentation algorithm, it can differentiate the data, it can determine the disease, and then after that radiologist need only re-verification. And then after that, AI can be used to help organize and analyze this data, which can improve efficiency and accuracy in the patient care. Because if there will be a burden upon the radiologist, there can be a compromise in the work. But if we use artificial intelligence, it can increase the accuracy and efficiency of the reports. And then after that, overall we can call the use of artificial intelligence in radiology has potentially to revolutionize the field by improving diagnostic accuracy. It can increase the diagnostic accuracy, help the radiologists and also the technologists in operating the machine. It will help the radiologists and technologists also. For technologists, it will help how to operate the machine, and for radiologists, it will help by determining the disease, and by classifying the disease. Next thing is, by improving diagnostic accuracy, increasing efficiency, and reducing the cost. It can also reduce the cost. The artificial intelligence can also reduce the cost of the various scans. However, it is important to note that AI is not made to replace technologists or radiologists, because re-verification is necessary. For each and every data, re-verification is necessary. There can be a problem in the software, there can be a problem in the machine. So that is why human brain re-verification is necessary. That is the re-verification by the technologist, re-verification by the radiologist is necessary. AI is not made to replace these two people, that is the technologists and radiologists, but rather to assist them. It will assist the technologists, and also it will assist the radiologists, also technologists and the radiologists, but rather to assist them in their work and provide more accuracy and efficiency patient care. By this, at the end, we can call that this can increase the accuracy, this can increase the efficiency in the radiology, and also in all healthcare sectors. So before I step down from this rostrum, I sincerely appreciate your attention today, this afternoon. This was all from my side. Thank you. Have a nice day. May God guide you all to what He loves. Khuda Hafiz. Take care. Bye. Sat Sri Akal. Assalamu alaikum and namaste. Bye.
Thank you so much, sir, for your valuable information about the role of artificial intelligence in radiology. Thank you so much, sir.
तू शाहीन है, परवाज है काम तेरा. तू शाहीन है, परवाज है काम तेरा. तेरे आगे आसमां और भी है. Now let us welcome our next speaker, Miss Bhavna Solanki, Assistant Professor at Santosh Medical College, Ghaziabad, Uttar Pradesh. Welcome her with a huge round of applause.
A very good afternoon to one and all present here. I have seen most of the students are sleeping. ज़्यादा खाना खाया है? ज़्यादा tasty था, ऐसा कुछ? Anyways, we have students from different institutions here. So let's show me your presence first. Who are the JNA student? JNA University student? Give me a yes, ma'am. Let's see your shouting speed. Next, we have students from Nanak Paramedical College. Great. Next, we have students from Organised Institute. Do we have? Okay, we do not have. Then we have students from Quantum University, Roorkee. कितना ठंडा यस मैम था, एक बार तेज के बोलो यस मैम. Great. Then we have student from संतोष मेडिकल. ये तो नहीं बोलेंगे तो उनको पता है. ठीक है. Anyways. Yes sir. Sant Baba. Okay, हाँ, I forget. Sorry. Sant Baba Bhag Singh University students. See the presence. Great. Okay, let's continue with the topic. Might be the topic is new for you guys, but you have to be very carefully try to listen the topic, because in your future context, whenever you go for the market, you will look for the research around you, right? So we all are the past from the era of COVID-19. हम सब ने COVID-19 face किया है, and we have seen that market में COVID की vaccine आई, right? तो किसी के घर में बनी थी क्या? It's come under the centers, right? ICMR ने बनाया, different institutions generate the vaccine. How many types of vaccines we have popular in India? तेज बोलो. कौन कौन सी डोज लगी है? कोवैक्सीन या कोविशील्ड? कोविशील्ड and कोवैक्सीन. So it's all a part of your research, daily research, right? In surrounding in our daily routines, we have research. So let's begin. When you complete your final year, most of your teachers will say, write a research project, do your thesis, do your dissertation. But most of the time, student will confused how to write it. उनको समझ ही नहीं आता हमें लिखना कैसे है, शुरू कैसे कर रहा है, thesis कैसे लिखनी है, right? So in my presentation, in my topic, we are going to discuss about how we will write a thesis or a dissertation or a research project. हम एक research project किस तरीके से लिख सकते हैं, right? So when we talk about research, so first thing what will come in our mind, what is research? Can any one of you tell me what is research? Can you break the term? Re means? Search means? कुछ find out कर रहे हैं, कुछ ढूंढ रहे हैं, तो किसी चीज को दोबारा ढूंढना क्या होगा? Research, right? So we have different types of definitions of research. Can we have this next slide? So here we have a definition of research. Research is an original and systematic investigation undertaken to increase existing knowledge and understanding of the current existing established fact and principles. Basically, when you talk about research, so we cannot say आज से research करना शुरू कर देती हूँ, ठीक है? कोविड वैक्सीन है, चांद पे पानी ढूंढने चले जाती हूँ, या आप चले जाते हैं, तो we cannot say कि हम immediately research करना शुरू कर देंगे. We have to think about what is the planning and what's the procedure to do a research. एक research की कैसे जाती है? Clear? We have another definition from another researcher. Research is a kind of study on a particular subject or an issue where the researcher utilizes scientific techniques. Basically, you can see the research in any of the particular topic, like you guys from BMLT background, OT background, physiotherapy background, nursing background. So you can do your research in your own background, right? Like for example, you belong from radiology, so you can do a survey, right, of the radiation protection in your hospital, in your particular setup. So we have different types of research surrounding us. Here we have a flow diagram through which we can explain the process of our research. So first we will start from ask a question. So first of all you have to create a question. आपको research करना किस पे है? Clear? हमें ये सोचना है ना research करें किस पे? कुछ नया ढूंढना है तो किस पे ढूंढना है? ये हमें check करना है. Clear? Then we have to create some observations. क्या उससे related research already हो रही है? हमें करने की ज़रूरत है. ऐसा नहीं कि मैं immediately उठ के कोई भी ऐसा topic ले लूँ research करने के लिए जिस पे कभी कुछ research हुई ही ना हो. समझा? तो आप उसको research को define नहीं कर सकते. You cannot explain that research. Then we have the questions related to the research literature, hypothesis, experiment, collect data, conclusions, share results, develop interventions. Again the same phenomena we are going through. So to continue our research we have a process. In our process we have few steps. Step number 1, 2, 3 till of 12 or 14 steps we have, right? Here we have our steps, so we are going to discuss these steps. So first let me explain you what is the difference between a thesis and a dissertation. Read it by yourself. Padho. Might be you people understood it. Thesis is a type of research paper based on the original research. It is usually submitted by the final step of master's program or a capstones of bachelor's degree, right? If you people are in BSc, MSc, then you people submitting your thesis, right? When you are pursuing your PhD or you are submitting your thesis research, it means you are submitting your dissertation. Got it? When you go through your syllabus, in your syllabus there is a two terms, thesis and dissertation. So जब आप BSc, MSc करते हैं तो आप thesis लिख रहे हैं, clear? जब आप PhD कर रहे हैं तो आप क्या लिख रहे हैं? Dissertation, clear? So next we have the steps to write a thesis and a dissertations. The first steps will be your title page. The title page will be a researcher's original page in which the researcher will going to write the name, आप कहाँ से हैं, what is your department, which program you are doing, what is your submission date, year, who is your supervisor, what is your university. So you are going to write all these things in your title page, right? Next you have acknowledgement. In your acknowledgement section you will going to thank all the persons who will participated in your research. Like for example a teacher who guided you that how to do a research. So some other staff, other members, professor, family members, friends, जिसको भी आप thank you करना चाहते हैं, जिन्होंने आपके research में contribution दिया. Then second step you have to write your acknowledgement. Next we have an abstract. So abstract will be a summary of your complete research and this will be the most important section of your research. Why so? Whenever you write a research, any researcher, for example, आपने कोई research किया और मैंने उसको पढ़ा. अगर वो research 5 पेज का है तो उसके first page पे abstract होगा. ठीक है? So through this abstract I can easily analyze is your research is valuable or not. Clear? So I do not need to read all the 20 pages. I have to just read these 150 to 300 words and I can easily analyze that my research or the concerned student research is absolutely great. Clear? Then we have a table of content, which is like of your practical exams. You have to maintain the table of content in which you are going to mention the headings, the page numbers. Then we have a list of figures and table. How many figures you have included in your research, thesis, dissertation, you have to include it in list number 5. Then we have a step number 6. We have so many of abbreviations, like sir has asked you about ECG, right? So ECG is short form. So we need to, for example, from other institution, any management student, does it know about the ECG? Any engineering student, management student, law student, does he or she know about the ECG? No, right? But we have to explain the term of ECG. That is the list of abbreviation. You have to give the full forms of your short terms. Clear? So that any person other than of your field can also understand the research. Then we have an introduction in your next chapter. So introduction will be related to your background information. For example, I am saying you give me your introduction. So what you people supposed to do? You just speak your name, from where you belong, from where you have done your schooling, what is your father name, right? This is what you're supposed to speak in your introduction. Similarly, in our research, whatever be the topic we have chosen, we have to explain the introduction, the background of the study, right? For example, I'm doing the research in radiology. So I have to explain about radiology. What is radiology? That will be the part of your introduction section. Then we have a next chapter of literature review, which is very important. So why this section is so important? Because this section will give you theoretical aspects or a theoretical framework of any gap analysis. For example, we have gone through newspapers, magazines, right, books. आप बोलते हैं ना, मैंने तो उस किताब में पढ़ा था कि ऐसा लिखा था, या मैंने किसी आर्टिकल में पढ़ा था इस तरीके से लिखा, इंटरनेट पे देखा था कुछ ऐसा लिखा था. तो जो आप पढ़ते हैं उसको इंफॉर्मेशन को गैप की तरह यूज़ करते हैं. दैट विल बी द पार्ट ऑफ योर लिटरेचर रिव्यू. लिटरेचर मतलब साहित्य, रिव्यू मतलब दोबारा देखना, राइट? सो लिटरेचर मीन्स एनीथिंग विच इज ऑलरेडी बीइंग रिटन, आपने उसको पढ़ना है दोबारा से. Then we have the next important section, that is of methodology. So our methodology section the methodology section will be including your types, which type of research you are going to do. Like it's experimental research, applied research, action research. Any research which is going into a laboratory is experimental research. Anything, for example, आप बोलते हो ना ये आजकल फैशन में है, ट्रेंड में है, ये खाना ट्रेंड में है, तो it's also a type of research. आप टीवी में देखते हो कि ग्रीन टी पीने से क्या होता है, फैट रिड्यूस होता है, मेटाबॉलिज्म एक्टिव होता है, राइट? सो दिस इज ऑल्सो अ टाइप ऑफ रिसर्च सराउंडिंग अस. तो वी ऑल आर थ्रू जस्ट बीइंग अराउंड ऑफ कंप्लीट रिसर्च फिनोमेना. In this section we also mention the data collection, how you collect the data. Next section will be your result, whatever be the studies being done, which method you have applied, which data you have applied, which types of statics you have applied. Through this section we will explain it. Next section is your discussion. In this discussion section, the researcher will give a you can say opinion about the research. For example, आपने कोई आर्टिकल पढ़ा और आप कह रहे हो कि उस पुराने आर्टिकल में रेडिएशन के बारे में ये जानकारी दी गई है और मेरी रिसर्च ये कहती है कि रेडिएशन से ये जुड़ा हुआ है कुछ. तो दिस विल बी योर डिस्कशन कि आप अपनी बात किसी और कही हुई रिसर्च से रिलेट कर रहे हो. दैट विल बी योर डिस्कशन सेक्शन. Then last will be your conclusion. Conclusion should be the main answer of your research. आपने क्या ढूंढा research से, that will be come under the section of your conclusion. Last will be your reference list. Reference, for example, whatever be the content you have used to write the research, कहाँ से लिया आपने वो content, किस book से पढ़ा, किस internet source से लिया, you have to give in that reference list. Appendix, it's optional sometimes. Few departments have this appendix protocols, other department do not have, for example. So in this appendix, any type of, for example, you are doing a research on hypertension. आप किसी patients का BP नापने की कुछ research कर रहे हो, तो that instrument will be come under the category of appendix. Proofreading is very important because when you have done your complete research, you have to reread your proofreading. It will give you a gap review. Whatever drawback, whatever error you guys have done in your research, that will be beneficial to you. So first question here, the first concern will be about the research topic. What will be the research topic and how to choose a research topic? कैसे ढूंढें कि रिसर्च किस टॉपिक पे करनी है? सबसे इंपॉर्टेंट चीज, रिसर्च करने से पहले क्या पता होना चाहिए? टॉपिक. So how you can go through a topic or a good topic? So choosing thesis or your dissertation topic is the first step in making sure research goes as smoothly as possible. So few requirements or few important points are given here. For example, research area of knowledge and interest. For example, you have knowledge about patient. आपको patient के साथ काम करना, patient की care करना बहुत पसंद है, या किसी को किसी equipment के साथ पसंद है काम करना, तो that is your area of interest. So you can choose that topic which is related to your interest only, जिसमें आपकी knowledge हो और आपको interest हो. Second, we have scientific, social and practical relevance also. The topic, whatever you are going to choose, it not should be irrelevant. It should be like of academic purpose, technical purpose, professional purpose. Availability of data and resources is very important. Sometimes students a topic which is not at all suitable for them. Then they come to their guide and said, sir कुछ मिल नहीं रहा है, हम कुछ ढूंढ नहीं पा रहे हैं, हमें इस टॉपिक से रिलेटेड कोई इन्फॉर्मेशन नहीं मिल रही है. क्यों? क्योंकि आपने टॉपिक ही गलत चूज़ किया हो. आपने एक टॉपिक वो चूज़ करना है कि जो तो ना तो बहुत ज़्यादा ब्रॉड हो, ना ही बहुत ज़्यादा नैरो हो. नैरो और ब्रॉड से सेंस है कि उस टॉपिक पे रिसर्च ऑलरेडी हो चुकी हो, सो दैट यू पीपल कैन हैव योर लिटरेचर रिव्यू, राइट. और ऐसा भी नहीं होना चाहिए जिसपे हर तीसरे बंदे ने रिसर्च की हो. दैट विल नथिंग विल बी न्यू आउटकम. अगर आप बहुत सारे रिसर्च सेम करते रहेंगे तो कोई न्यू आउटकम आपको नहीं मिलेगा, राइट. सो दैट विल बी द इम्पॉर्टेंट पॉइंट. अनदर इम्पॉर्टेंट, so check the requirement, determine the maximum word count, what is the deadline of your, for example आपके टीचर्स ने आपको बोला कि 3 महीने में रिसर्च खत्म करनी है और आपने टॉपिक ले लिया जो 1 साल में भी खत्म नहीं हो रहा. तो you have to keep in your mind कि जो भी आप टॉपिक चूज करेंगे that should be come into the category of deadlines. Choose a broad field of research as I have already discussed with you guys. List for books and articles. These are the few links I have provided here through the Google Scholar, and when you click on this link, you will get the top journals details from here. Specific scientific databases are here. Consider the type of research. It is very important. आप किस type के research करने वाले हैं? Social research है, experimental research है, applied है, action है, exploratory है. किस type के research करने वाले हैं? That should be keep in your mind once you select your topic. Determine the relevance that I have already told you. Get researcher's topic approved. So once you have decided the topic, go to meet your guide or your teacher and ask him, sir or ma'am, I have choose this topic. Is this topic is relevant or not? Right? Get your approvals from your respected teachers. Then how to write a introduction and the thesis. So introduction will be focused about your previous research or about the background, whatever with a clear focus, direction related to the relevant topics. A few objectives. For example, after completion of your BSc Radiology, what will be your objectives? आप क्या करेंगे BSc Radiology complete करने के बाद? BSc OTT करने के बाद what will be your objectives? So this will be again the same as of your research. आप जो भी topic use करेंगे उसका objective क्या होगा? What will be the objective of that research? Introduction at last of your checklist. Then we have another section, how to write a literature review, because that what I have felt in my students also, they felt difficulty in this section. They ask me again and again, ma'am, how to write a literature review? एक literature review लिखना कैसे है? उनको पता ही नहीं होता. So through this section we have look on how to write a literature review. So whenever you write a literature review, few key steps should be keep in your mind. Search the relevant literature. How you can search a relevant literature? For example, I have given you a topic related to the hypertension, and you people immediately put into the Google, and whatever with the first link is come, you open and start reading it, right? आप यही करते हैं ना? मैम आपसे पूछती हैं तो आप क्या करते हैं? गूगल करते हैं, पहला वर्ड डाला, जो भी आना शुरू किया, आपने मैम को कहानी सुनानी शुरू कर दी. क्लियर? यही करते हैं, बट ऐसा नहीं करना. यू हैव टू फाइंड आउट द ऑथेंटिकेटेड सोर्सेज फॉर योर रिसर्च. Authenticated, either it's a book, it's a magazine, it's a newspaper, it's a journal or published paper, right? Your source will be authenticated, genuine. Then you have to evaluate the source, identify themes, database and gaps, outline the structure, write research literature review. So what is the purpose of literature review? We have already discussed. This will keep your mind to be clear what will be your gap in your research. For example, मैं कह रही हूँ कि मेरी रिसर्च में ये गलतियाँ हुई थी, आपने मेरी रिसर्च पढ़ी और आपने बता, मैंने लिखा मेरी रिसर्च में मैंने ये गलतियाँ की, तो आप अपनी रिसर्च में वो गलतियाँ करेंगे? Definitely not. So that's the importance of literature review. Every good researcher need to mention their limitation in their research. कोई भी रिसर्च 100% परफेक्ट नहीं होती, तो उसके अंदर कुछ ना कुछ ड्रॉबैक लिखा जाएगा, लिमिटेशंस लिखी जाएंगी कि इस तरीके से रिसर्च लिमिटेशन में यूज़ की गई है. आप उसको पढ़ेंगे, देन यू कीप इन योर माइंड क्लियर कि मुझे ये गलतियाँ नहीं करनी है. क्लियर? So how you can do this? I have given this few sources, two relevant sources to research about a literature review: Google Scholar, Joster, AppSco, Project, Medline, Scott, Inspect. You can go through the link and you can have the study material from the Rajdeep sir if needed. Then what is the publication, authors, address, key concepts, theories, models, conclusion क्या है study का, what will be the result of your study. जब भी आप किसी पुरानी रिसर्च को पढ़ें तो सबसे पहले उसमें ये पढ़ें कि वो रिसर्च की कैसे गई है, what is the method of doing that research. क्लियर? उसमें टाइम ड्यूरेशन क्या था, उसको किया किस तरीके से गया. मान लीजिए आपने ले लिया कि मैं सीटी की डोज निकालूंगा, ठीक है, आई विल कैलकुलेट अ सीटी डोज, बट आपको पता ही नहीं है व्हाट इज सीटी डोज एंड व्हाट इज द मेथड ऑफ कैलकुलेटिंग अ सीटी डोज. तो फर्स्ट ऑफ ऑल यू नीड टू क्लियर इन योर माइंड दैट वट एवर बी द टॉपिक यू हैव चूजिंग, यू हैव टू मस्ट गो थ्रू द लिटरेचर रिव्यूज, प्रीवियस रिसर्चेस ऑफ दैट पर्टिकुलर टॉपिक. इट विल मेक्स योर माइंड मोर क्लियर अबाउट योर टॉपिक. Then we have the themes, debates, gaps, goals we have discussed. Now comes to the section of literature review. That is the important part, write literature review. So whenever you read any previous year article, first of all you have to write the introduction about the topic, what the introduction is, किस बारे में वो topic लिया गया है या किस बारे में वो research की गई है. Then the center section of the literature review come under the category of body. Body contains 4-5 steps. Critical evaluation, analyze the interpretation, and last section will be the conclusion. Most of the time students used to do जो abstract में लिखा है वही उठाकर literature review में लिख दिया जाता है, ठीक है. That will be a very wrong way to write a literature review. Whenever you writing a literature review, आप समझ लीजिए कि आपको एक पूरी मूवी देखनी है और उस मूवी को अपनी भाषा में समरी करना है. समझ आया? तो मैं पूछ रही हूँ कि मूवी शुरू कहाँ से हुई थी, दैट शुरू जब हुआ तो दैट इज अबाउट इंट्रोडक्शन. क्लियर? फिर मैं पूछ रही हूँ मूवी का मिड में क्या था, दैट्स विल बी अ बॉडी पार्ट ऑफ लिटरेचर रिव्यू. देन आई एम आस्किंग व्हाट इज द एंडिंग ऑफ दैट मूवी, तो दैट कम अनटू द conclusion. Similarly you have to do with your research articles. Whatever with the previous year paper, previous year research articles you have to read it completely, make a introduction, make a body, and make a conclusion of the same topic. Then the methodology, important section another. This will give you a type of research and again the data collection. देखिए for example आप Flipkart use करते हैं, everybody is using Flipkart. Amazon, everybody is using. You people are buy something and you are sharing your feedbacks, ratings. That's also a part of your research. You are submitting your rating. आप feedback लिखते हैं ना, हमारा product कैसा था, हमारी feedback कैसी है, rating कैसी है. It's also a part of research. तो you people indirectly will be a part of your survey. उस product को लेके आप उस survey का एक हिस्सा बन गए. तो again the same thing you have to do in your research about your collection of data. Either it's an interview method, it's a questionnaire method, it's an observation method. Face to face किसी से information लेना, that is interview method. किसी को number of series of questions provide करना, कोई questions पूछना, that is questionnaire method. Observation through the observation, right? I have shared a tip here, like whenever you're writing a research methodology, it should be in past sentences always, because most of the students forget to write the sentence into the past sentences. So whenever you're writing the methodology, it should be come into the category of past sentences. Why this section is important? We have discussed because it's give our researchers to idea how this research is being conducted and how is it being implemented. I'm skipping these sections. Now comes to the result section. So a result is where the researcher report the main finding of the data collection and analyzes research conduct for the thesis or dissertation. what you will going to write in a result, आपने जो भी data collect किया होगा किसी participant से, you have to just use any software to analyze data. Like for example, we have Smart Excel, R, like SPSS, we have so many tools and devices to check this data collection methods. This is important, result versus discussion versus conclusion. Most of the time, student writing the same thing in the discussion and same thing into the conclusion. तो बच्चों को पता ही नहीं होता कि हमें discussion में क्या लिखना है और conclusion में क्या लिखना है, right? So we have to clear about it. It should not be speculate about the meaning of the result or attempt the answer from the main research problem. Detailed interpretation of result is more suitable for researcher discussion, while synthesis of result into the overall answer to the main research questions is felt to be research conclusion. Whatever be the research you have done that is being discussed with other research will come into the category of discussion, and your own original finding will become into the category of conclusion. Write a discussion, you need to do a summary, why this result is mean, why results matters, or what is the interpretation of your research. Don't introduce new results, that is important. Researchers should only discuss the data that researchers have already reported into the result section. तो आपको वापस से discussion में अपना result लिखने की ज़रूरत नहीं है. You have to just give a theoretical framework of your result into the discussion section. Do not make inflamed claims. Avoid interpretation, speculation. Don't underestimate the researcher's strength and the credibility. Not to forget to acknowledge your limitation, as I already said, because it's very important for the further researcher to let them research to be easy. आपने कोई research की, गलती की, आपके बाद किसी ने research की, let them people to avoid their mistakes, right? Through this section of limitations. Last section is conclusion. Clearly state the answer of the main research problem, summarize the reflect on the research process, show that the new knowledge have contributed in the research, and wrap up of your research into the conclusion section. I have given some examples because short of time, I'm not going through it. Thank you so much. Before I just leave the podium, I want to thank all the management of Guru Nanak Paramedical College, all the faculty members, speakers, students for giving me the opportunity to present my topic for today's event. Thank you so much. Have a bright future to all the students. Thank you.
Thank you so much, ma'am, for your valuable information. Now, I would like to invite our mentor, Mr. Rajdeep Thidwar, General Secretary Sir, Mr. Kulvinder Singh Taha, to please come on the stage to facilitate our faculty members from different universities. Firstly, I would like to invite Miss Sonia Sharma, Assistant Professor, Department of Microbiology, Sant Baba Park Singh University, Jalandhar. Give a huge round of applause for the ma'am. Thank you so much, ma'am. Now, I would like to invite Miss Lakshmi, Assistant Professor, Department of Radiology and Imaging Technology, Quantum University, Roorkee, Uttarakhand. Moving further, I would like to invite Mr. Gajendra Singh, Assistant Professor, Department of Operation Theatre Technology. Give a huge round of applause for Mr. Gajendra Singh. Now I request our convener, Mr. Virinder Singh Barar, to please come on the stage. Now, I like to invite Mr. Amir Rasool Bhatt, Assistant Professor, Department of Operation Theatre Technology, Pai Gurdas Group of Institutions, Sangrur, Punjab. Give a huge round of applause for Sir.
Thank you, sir. Now, I would like to invite Ms. Lakshmi, Assistant Professor, Department of Radiology and Imaging Technology, Quantum University, Roorkee, Uttarakhand. Give a huge round of applause for ma'am. Thank you, ma'am. Well, I would like to invite Mr. Navreet Bora, Assistant Professor, Radio Imaging Technology, SGT University, Gurgaon. Give a huge round of applause for Sir. Thank you, sir. Now, it's time to invite Mr. Navdeep, Director, Med Skill Educational Society, Jajjar, Haryana. Please give a huge round of applause for Sir. Thank you, sir. At last, I would like to invite Mr. Kripa Anand Yadav, Assistant Professor, Radiology and Imaging Technology, Mahashri Market, MMV University. Now, it's time to give awards to the organizers. So I would like to invite
सॉरी टू इंटरप्ट यू, क्षमा दान दें मुझे कि मैंने आपको बीच से रोक दिया। आज के इवेंट को सफल बनाने के लिए सिर्फ एक व्यक्ति का परिश्रम काफ़ी नहीं होता, ये एक सम्मिलित टीम वर्क है जिसको पूरा करने के लिए हम सभी ने एक टीम की तरह काम किया। अभी वक्त है कि उनको हम सम्मानित करें, उनके एफर्ट्स को सराहना दें। तो मैं सबसे पहले आई वुड लाइक टू कॉल मिस प्रभजोत कौर खटकर, असिस्टेंट प्रोफेसर, डिपार्टमेंट ऑफ मेडिकल लैब साइंस, गुरु नानक पैरामेडिकल कॉलेज। स्टेज का सारा मैनेजमेंट हमारी प्रभ मैम ने देखा, उसके लिए हम आभार व्यक्त करते हैं। And now, a very important person of this event who take care of the screen management, आप सबकी PPTs, आप सबके e-posters, आप सबका आना, जिन्होंने इस सब को सजो के रखा, मिस्टर मुदासिर मोहिउद्दीन, असिस्टेंट प्रोफेसर ऑपरेशन थिएटर टेक्नोलॉजी। Tremendous, speechless work done by Mr. Mudassir Mohuddin. आज के हमारी इस वेन्यू को सजाने का, संवारने का, हमें बैठने के लिए इतनी अच्छी जगह देने का, अच्छा खाना खिलाने का, ये सारा अरेंजमेंट लाइक अ वन मैन आर्मी, मिस्टर मोहिंदर पाल सिंह, ऑफिस सुपरिटेंडेंट, गुरु नानक मिशन मेडिकल एंड एजुकेशनल ट्रस्ट। And now, a very important person, हमारी सुरक्षा, सारा अरेंजमेंट जिन्होंने सिक्योरिटी हेड के रूप में काम किया, मिस्टर रंजीत सिंह, ऑफिसर सिक्योरिटी हेड, गुरु नानक मिशन एजुकेशनल ट्रस्ट। हमारे डे 1 के रजिस्ट्रेशन से लेकर पैरामेडिकल मीट के सर्टिफिकेशन तक की जिम्मेदारी जिन्होंने बखूबी निभाई, हमारे ऑफिस कोऑर्डिनेटर मिस्टर सुखबीर लाल, गुरु नानक पैरामेडिकल कॉलेज। And now I would like to introduce one more person who gave the immense contribution in this event. आप सब तक ब्रोशर को पहुंचाने का काम. The credit goes to Mr. Rajesh Rohilla, Assistant Professor, Sant Baba Bhag Singh University, Punjab. Thank you so much, sir, for giving your precious time. I'm requesting you kindly take your seat. I'm going to hand over mic to Miss Komal and Miss Diya too. Thank you.
जब टूटने लगे हौसले तो बस ये याद रखना, जब टूटने लगे हौसले तो बस ये याद रखना, बिना मेहनत के हासिल तक तो ताज नहीं होता, बिना मेहनत के हासिल तक तो ताज नहीं होता। ढूंढ लेना अंधेरों में मंजिल अपनी, ढूंढ लेना अंधेरों में मंजिल अपनी, जुगनू कभी रोशनी का मोहताज नहीं होता, जुगनू कभी रोशनी का मोहताज नहीं होता। Now, moving further, now let's welcome our next speaker, Miss Piyushi Yadav, Assistant Professor, Sant Baba Bhag Singh University, Jalandhar, Punjab.
Good afternoon, one and all present over here. I, Piyushi Yadav, Assistant Professor, Radiology and Imaging Technology, extremely honored to have such a great opportunity to speak in front of this honorable gathering. So my topic for today's event is scopes and opportunities in paramedics. So let's start the topic. Hello. So next slide. Okay, so I think maximum students are present here are from paramedical background. So I would like to discuss firstly with what paramedical exactly is. So anybody will able to answer this, what paramedical word means? Yes, anyone? From student side only. What is paramedical means? Or what do you mean by paramedical? You're from paramedical profession, right? So what this word exactly means? Yes, any student from paramedical background? Okay, she is saying helping hands. Very good, clap for her. Any student from Sant Baba Bhag Singh University? Yes, Mr. Paras. What do you mean by paramedical?
It can be a helping hand to someone.
Okay, it's quite right. Anyone else from Quantum University or Santosh Medical College, whom we call paramedical professionals? You're from paramedical background. So what is the definition of a paramedical professionals? Yes, anyone from Santosh Medical College?
Help. Paramedical staff is helping hand for medical professionals.
Okay, so we can say we are only the helping hands. Yes, Ikra? We are the helping hands. Yes? Backbone of the hospitals, right? Okay, so paramedical is formed by two different words, which is para and medical. Para word means adjacent to something, or it means nearby or resemblance. And medical word means practice of medicine. So when we combine these two words, it means a person who is adjacent to the medical practitioners, right? This is paramedical word means, and this word refers to the science or the practice of medicine, okay? So medical word means the knowledge of science, or the person who is having the knowledge of science and the practice of medicine. So what paramedical word refers, it refers the science and the practice of medicine in maintenance or restoration of the health and normal functioning of the human body. Okay, so who is the paramedical professionals now? The paramedical professionals are the healthcare workers who helps in clinical practice or who helps in clinical services of the patients and provide the guidance to the, or who works under the supervision or guidance of the medical professionals. It could be radiologists, it could be physician, it could be nurses, or any other medical professionals. So these are the roles of paramedical professionals. Okay, we frequently use this word specifically for the fully trained and qualified healthcare workers who help in medical sectors. Okay, so there are number of paramedical courses which are available in India. Okay, I think more than 15 courses are available in paramedical. So paramedical courses are the courses related to the field of allied healthcare and related sectors. Okay, we also call paramedical field allied healthcare field, right? So these courses focus on the smooth functioning of the healthcare center by taking care of its associated fields. Okay, these courses help you become a professional in secondary medical sectors. What are these medical sectors? It could be MLS, it could be radiology sectors, or it could be any other sectors which are available in paramedical field. Okay, these courses are high in demand, on demand because of the acute shortage in the allied industries. Okay, we all have come across through the pandemic situation, right? So after the pandemic, there is a mushrooming of hospitals in each and every state, okay, which cater the need of medical professionals, right? So for fulfilling this demand of medical professionals, there is a huge demand or opportunities in paramedical field. So paramedical courses are aimed to train students so as to turn them into accomplished, responsible, quick and qualified allied healthcare workers and technicians. Why we are using quick word here? Because we are providing some short-term courses in paramedical like certificate courses or advanced diploma courses, which will provide the quick degree or certificate to the students. Next, what are the course features which makes this course different from the other one, like from engineering or any other profession? Why this course is better than any other course? Because it provides the good employability. Why? As we all know, after the outbreak of COVID, सबसे ज़्यादा क्या डिमांड थी? कोविड टाइम पे कौन से सेक्टर की सबसे ज़्यादा डिमांड थी? पैरामेडिकल, सारे अदर मेनली जो भी अदर सेक्टर्स थे, चाहे वो बैंकिंग सेक्टर हो, चाहे कोई भी अदर फील्ड्स हो, सभी शट ऑफ हो गए थे. लेकिन एक ऐसा फील्ड था जो ऑल टाइम ओपन था कोविड टाइम पे, दैट इज पैरामेडिकल सेक्टर. तो एम्प्लॉयबिलिटी जो ग्रोथ है पैरामेडिकल में वो काफ़ी अच्छी है. सैलरी स्कोप इज वेरी गुड इन पैरामेडिकल सेक्टर. Growth is high, professional stability is good, and recessional effects. We all see the example of recessional effects in COVID time already. क्योंकि जो इसमें अनएम्प्लॉयबिलिटी रेट था, जो राइज अप हो रहा था अनएम्प्लॉयबिलिटी का, वो सारी ही फील्ड्स में काफ़ी ज़्यादा था. बट व्हेन वी कंपेयर द पैरामेडिकल सेक्टर फ्रॉम एनी अदर फील्ड, तो ये जो सेक्टर था सिर्फ यही एक ऐसा सेक्टर था जो कोविड टाइम पे भी डिमांड में था. उसमें निकाले नहीं जा रहे थे लोग. कोविड टाइम पे भी लोगों को ज़रूरत थी कि पैरामेडिकल प्रोफेशनल्स और हेल्थ केयर वर्कर्स मिले और उनका हॉस्पिटल स्मूथली रन हो. राइट, तो इसका तो बेस्ट एग्जाम्पल हम लोग कोविड टाइम में ही देख चुके हैं. नेक्स्ट, टुडे द एडवांसेस इन द हेल्थ केयर सेक्टर आर ड्रामेटिक एंड द डिमांड ऑफ पैरामेडिक इज इंटेंसिफाइंग. The life expectancy of the population has increased owing to new treatments and technology advancement. Lastly, क्या होता था कि पैरामेडिकल सेक्टर में नंबर ऑफ फील्ड्स ही अवेलेबल थी. ठीक है, रेडियोलॉजी फील्ड भी बहुत मुश्किल थी. कोई बच्चा था जो रेडियोलॉजी कोर्स ऑप्ट करता था. इवन आई थिंक 2012, 2013 इन जो ये ईयर्स थे, इस टाइम तक भी पैरामेडिकल का कहीं पे भी नहीं था, कोई रिकॉग्निशन नहीं मिला था. बट कोविड के बाद से ही ये फील्ड बहुत ज़्यादा हाईलाइट हुई है और एकदम लाइमलाइट में आई है. कोविड से पहले इसका इतना ज़्यादा कोई नहीं जानता था कि क्या होता है पैरामेडिकल, रेडियोलॉजी प्रोफेशन क्या होता है, MLS क्या होता है. ठीक है, सो यू कैन रेस्ट एश्योर्ड दैट देयर विल बी ऑलवेज बी अ ह्यूज डिमांड ऑफ योर स्किल्स एंड एक्सपीरियंस आफ्टर यू कंप्लीट योर पैरामेडिकल कोर्स प्रोग्राम. Now there are different types of courses which are available in paramedical sectors. Although there are more than 15 courses are available, but we are going to discuss few courses here which are high in demand. Okay, so there are different types of courses you can opt for the various levels in course models. These are certificate courses, diploma courses or advanced diploma courses, bachelor's courses, postgraduate courses, and nowadays PhD is also available in paramedical fields. You can pursue your PhD in radiology department or in MLS. So this is a good option for paramedical students. Now let's discuss the pros and cons of these courses. So in bachelor courses, it provides a good salary prospectus. The bachelor degree course is of three-year course plus 1 year internship. So it has a good prospectus of growth and higher studies. It means after pursuing your bachelor's in any paramedical field, you can pursue master's and PhD as well. So it means you can continue your higher studies after completing your bachelor's course in any paramedical field. So next is certificate courses in paramedical sciences. So certificate courses are also available in paramedical field. So what are the pros of these certificate courses? It is the shortest duration course. It means you can usually it took 6 months for completing this course. After 6 months you will get the certificate and you can apply anywhere for job purpose, right? It provides quick job acquisition because just after completing 6 months certificate course you will get the job in any institute or in any hospital. It is the cheapest option because the fee structure is minimum because they are providing only 6 months certificate course. So the fee structures will be minimum in certificate courses. It facilitates early entry into the workplace and it grants you the lowest possible qualification to join the healthcare workforce. Okay, 6 months से कम qualification क्या ही होगी. इतने में तो computer course भी होता है, DCA, Tally, EP39, ये भी 6 months से ज़्यादा का होता है. तो बहुत ही मिनिमम टाइम में आप ये सर्टिफिकेट कोर्स कर सकते हैं और उसके बाद आप किसी भी हॉस्पिटल में किसी भी ऑर्गेनाइजेशन में एज अ मेडिकल प्रोफेशनल ज्वाइन कर सकते हैं. ठीक है, दीज आर द प्रॉस बट देयर आर कॉन्स ऑल्सो ऑफ दीज कोर्सेज, सर्टिफिकेट कोर्सेज विच वी हैव टू डिस्कस हियर. इट ऑफर्स अ लो सैलरी. व्हाट इज द रीज़न बिहाइंड दिस? ऑब्वियसली अगर आप किसी ऑर्गेनाइजेशन में जा रहे हो वहाँ पे एक सर्टिफिकेट कोर्स का स्टूडेंट है और एक ऐसा स्टूडेंट है जिसने बैचलर्स कोर्स किया हुआ है, जिसने मास्टर्स भी की हुई है, उसके पास PhD की भी डिग्री है. तो जॉब सेम ही है लेकिन जो उसके लिए कैंडिडेट्स आ रहे हैं एक बहुत ही हाईली क्वालिफाइड है और एक के पास सिर्फ सर्टिफिकेट कोर्स है. तो जॉब अपॉर्चुनिटी जो है वो किसके लिए बेहतर होगी? यस दीपिका, किसके लिए बेहतर होगी जॉब अपॉर्चुनिटी? जो ऑर्गेनाइजेशन है वो ऑब्वियसली जो हाईली क्वालिफाइड कैंडिडेट है उसको ही प्रेफर करेगी. So that's why it offers a low salary. अगर किसी सर्टिफिकेट कोर्स वाली कैंडिडेट को रखते भी है तो उसका जो सैलरी ग्राफ होगा वो बहुत ही मिनिमम होगा. Next is the prospectus of higher studies and growth are not brilliant because after completing this course you are not able to get admission in any bachelor's or in any master's degree, right? If you join a job with just a certificate course, it may not help you improve academically related to other courses. Next, we will talk about the diploma and advanced diploma courses in paramedical science. So diploma and advanced diploma programs are a perfect balance of the certificate and bachelor's courses because certificate courses, the duration of certificate courses is of 6 months and the duration of diploma courses is 1 year or we can say 2 years. So this is the balance between the certificate course or we can say bachelor's degree, right? Okay, a great option for those looking to spend less on their qualification program, earn fast in relatively short duration of time. Because if you will opt the bachelor's degree, then it will take more than 4 years for completion, right? But if you are opting the diploma course, then it will only take 1 or 2 years for completion. Work in a profession with good growth prospects. Work in a profession with increasing job opportunities. So what are the pros of these diploma courses? It means the good things in diploma. A diploma course is usually a 1-year course or we can say a 2-year course and hence a short investment of time. अब जो लोग सोचते हैं कि हाँ ठीक है उनकी उम्र बहुत ज़्यादा हो गई है 35-40 क्रॉस हो गया अब क्या ही कोर्स करें डिग्री करने में तो बहुत टाइम लगेंगे तो वो लोग ऑप्ट कर सकते हैं डिप्लोमा कोर्सेज भी. इसकी जो टाइम ड्यूरेशन होती है वो बहुत ही शॉर्ट होती है और उसके बाद यू आर एलिजिबल टू ज्वाइन एनी इंस्टीट्यूट एनी ऑर्गेनाइजेशन और एनी हॉस्पिटल, राइट. Right, okay, these courses make you job ready in a short time frame. हाँ कुछ लोगों के घर की भी फाइनेंशियल रीजंस होते हैं, कंडीशंस होती है जिसकी वजह से बच्चे एक कोर्स ऑप्ट करते हैं डिप्लोमा कोर्स rather than opting a bachelor's degree. So what are the cons of the diploma courses? Professional with degree courses are preferred over diploma holders. Obviously, if there is a candidate available in bachelor's degree, then the organization will select the bachelor's holder. He will not select the diploma candidate. Okay. Diplomas can be used for limited job roles. Next, we are going to discuss few bachelor courses which are high in demand, especially after the COVID outbreak. So I think there are three main courses in paramedical which are highly in demand. These are radiology and imaging technology because we are diagnosing the COVID outbreak with the help of the modalities like X-rays, CT scans. So these are high in demand after the pandemic situations. And next are operation theatre technician and medical laboratory fields. So these fields are in demand after the pandemic situation. So we are going to discuss them in brief. Okay. So what are radiology and imaging technology? So bachelors in radiology and imaging technology will take 3 plus 1 year internship for complete duration. These degree courses is designed for students who want to become paramedical professionals. These graduates are an integral part of medical science, or we can say the radiology is the eye of the hospital, because without radiology we cannot diagnose or we cannot see the internal pathology of the human body, or any disease or any injury which is occurring in human body, we cannot diagnose it without the help of radiology. So we can say the radiology is the eye of the hospital. Okay, so here we are using a number of modalities like computer tomography, X-rays, magnetic resonance imaging, ultrasound. There are a number of modalities which are available in radiology department, in which some are using ionizing radiation, which is obviously harmful for body, but there are few modalities in which we are not using any type of radiation. They are fully radiation free, like magnetic resonance imaging and ultrasound. We can get the information of the internal body structures without giving any radiation dose to the patient. Okay, radiology is a highly developed technology that helps medical professionals to diagnose the disease or internal pathology of the human body. The radiology domain is divided into 3 fields. The first one is diagnostic imaging, and the second one is interventional, and the last one is therapeutic radiology. So what is diagnostic radiology? Diagnostic radiology is a medical specialty in which we use number of modalities to diagnose the disease or injury, or to take the images of the internal structure of the human body, or we can say with the help of diagnostic radiology we can get the information of human body anatomy and the physiological information of the body. So this is all about diagnostic radiology. In this we use number of modalities. You can also see the images. We use CT, MRI, ultrasound in diagnostic radiology. Okay, next one is interventional radiology. So what is interventional radiology? Interventional radiology is a medical subspecialty in which we use a minimally invasive technique or image guided modalities to treat or to diagnose or to treat the pathology, right? The procedures which comes under interventional radiology are biopsy. You all have heard this term, I think, what biopsy exactly is, right? So the procedures comes under interventional radiology are biopsy, angiography, catheterization and many other procedures which successfully done with the help of interventional radiology. Next is therapeutic radiology. Therapeutic radiology also includes the diagnosis as well as the treatment of the patient. The modalities which we use in therapeutic radiology are cyber knife, gamma knife, or the modalities which we use to diagnose the treatment or to diagnose the pathology are PET CT, gamma camera and many other modalities which we use to detect the cancer. And we use some radiotherapy procedures or radiotherapy machines to kill the cancerous cells in this field, which we call therapeutic radiology. Next, job opportunities after completing bachelor's radiology imaging technology course. So this is the main factor. That's why we opt any paramedical course for job opportunities, right? So there are number of job opportunities in radiology field, but we are going to discuss only few of them because you might familiar with all the job opportunities which are available in radiology field, because I think the majority of the students present here are from radiology department, and you all know the job opportunities after completing radiology imaging technology are radiographer, we can say X-ray technician or CT technician, technologist, MRI technologist, assistant professor. You can opt teaching career as well. We all are familiar with all the opportunities which are available in radiology field. But I think these three job opportunities are something unique which we haven't heard before. Might be you have heard because you all from paramedical background, but I think these are some unique field or unique professions which we can opt after completing our bachelor's in radiology. So these are radiation safety officer, the second one is junior research scientist, and the last one is application specialist. Okay. So what is radiation safety officer? Who is going to answer this? Any radiology student, who is radiation safety officer? Yes? Amisha, you want to answer this question? Who we call radiation safety officer? Or what are the roles and responsibilities of radiation safety officer, or we can say RSO? Anyone? Protection. She is saying radiation safety officer is a protection. Who can expose the patient? Who can expose patient? Radiation to the patient. Who can expose radiation to the patient? Okay, this is the role of radiographer. I think radiographer is the one who will expose or who is exposing the patients, right? So what is the responsibility of radiation safety officer? Why this profession is here in radiology field? Yes, Amisha, you want to answer this? Yeah, stand up. Sir, please provide her mic.
मैम, जो RSO ऑफिसर्स होते हैं, मैम वो चेक करते हैं कि जो हम जिस भी डायग्नोस्टिक सेंटर में हम काम कर रहे हैं उसका हमारे पास लाइसेंस है। हम अब उस रूल को अगर हम ब्रेक करते हैं तो वो हमें पेनल्टी डाल सकते हैं और हमें उससे उस फील्ड से बाहर कर दिया जा सकता है। RSO का काम।
Good answer. Anyone else want to answer this question? I think फिर ये बताने की ज़रूरत है that who is radiation safety officer, right? So radiation safety officer is a person who manage the radiation safety programs or who ensures the use of radiation or use of radioactive materials in an organization or in hospital or in any research institute, or who will check the qualification or training of the person who is dealing with the radiation. Okay, so these are the roles and responsibilities of radiation safety officer, and he will also take the initiatives to apply the corrective measures to do improvement in radiology field, right? So these are the responsibilities of radiation safety officer. Next is junior research scientist. So who is junior research scientist? Any idea? Yes? You can become junior research scientist after completing your bachelor's in radiology. Can you? Yes? Paras? बन सकते हो आप junior research scientist? बन सकते हो? Okay, the minimum qualification to opt this profession is PhD in the specialized domain like in radiology, and in this we have two subcategories. We have a senior research scientist or junior research scientist. What is the role of research scientist? They help in the advancement, okay? They give new advancement to the radiology field, or they enhance, or they we can say ये जो भी हमारी मोडेलिटीज़ होती हैं, जो भी वी आर यूजिंग इन रेडियोलॉजी डिपार्टमेंट, उसकी क्वालिटी कैसे इंक्रीज हो सकती है, दे विल हेल्प इन दिस, राइट? सो नेक्स्ट इज एप्लीकेशन स्पेशलिस्ट. Application specialist is a person who train the radiation or workers who are or the people who are working in radiation field, or who check the functioning of the equipments we are using in radiology department. It could be MRI, it could be ultrasound and any other modalities which we are using in radiology field. The application specialist check the functioning of these equipments, and they were present at the time of installation to look after them. So these are the responsibility of application specialist. Next, operation theatre course. Okay, if you pursue your career in operation theatre course, then you have to check the setup and maintain an anesthesia machine and monitor life support equipment like airway equipment, ventilator, emergency equipment, defibrillator, anesthesia and resuscitation drugs. Okay, so what is the responsibility of operation theatre technician? He maintains the record, and he also maintains the patient history, or he checks whether the operation theatre or OT where we are going to perform the procedure is fully sterilized or not. So these are the responsibility of operation theatre technician. He also maintains and keep records of all anesthesia equipment which are available in OT. Okay, he assists anesthetist in inpatient procedures like setting up invasive lines, airway management, monitors and administering anesthesia to patient, and he also assists during the emergency in critical events or basic and advanced life support. So these are the responsibilities of OT technician. Now what is the scope of operation theatre technology? In management of the Central Sterilized Services Department, packing of equipments and lining, sterilization procedure like autoclaving. So the main role of operation theatre technician is to keeping the record and check the sterilization or disinfectants is there or not. These are the roles and responsibility of operation theatre technician. Next is medical lab technician course scope. So though all of these here MLT have been working behind the scenes, but after the COVID-19 outbreak, it has caught the attention worldwide, and the demand of laboratory science technician has increased day by day after the pandemic situations. So the job will involve collecting, labeling and analyzing the samples, executing labeling testing, and recording all data accurately, and they also maintaining all laboratory equipment. Job opportunities you can get after pursuing BSc MLS course. The successfully degree holders of this course perform duties such as analyzing human body fluids and get a job or work at the following places, like they can self-establish their clinical lab and they can work over there. Next, pass out graduates can also join private laboratories as well as lab technician or technologist in hospital or research institute, or they can also opt the career in academics, right? Next, hospital administration course. After graduation in any allied and medical health stream, PG programs such as Masters in Hospital Administration prepares students for administrative position within the hospital. So what are the roles and responsibility of an hospital administrator? They coordinate with the employees who are working in an organization or in hospital especially. They collect the data management and they supervise the data managing procedure, and they also work process and strategize for improvement in hospital sector, and they complies policies and they check the finances and many other duties which are done by the hospital administrations, right? Why should you choose paramedics as a career? Okay. As the pandemic spread, we experienced an epiphany that more and more skilled and qualified paramedics are required for strengthening the backbone of the healthcare industry. Employment opportunities for paramedical professionals are increasing day by day, not only in India but also in foreign countries. Okay, the scope of the paramedical sector in today's world is immense, as there are plenty of job opportunities are available in public as well as in private sectors. So healthcare industry is considered to be one of the fastest growing industry over the worldwide. Okay, moreover there is a great need in paramedical sector of improvement. So the world has come to face the pandemic situation, so they have faced the ground reality that there is a need of paramedical professionals in medical sectors, right? Next is emergency medical technology. There are number of courses which are available in paramedical sectors, so we are going to discuss them in brief. The first one is emergency medical technology. They are deal with responding in basic emergency life-saving situations, or emergency medical technology constitute an emergency response team. Okay. Next course is ophthalmic technology, or we can also say operation theatre course. The technicians are trained to conduct eye exams and educate patients to wear contact lens and care of their eyeglasses. Next is dialysis technology course. So the technicians who done this course are assist patient with the renal disease. Okay. Next is cardiac technology. They are trained to conduct tests to record heart activity using specialization equipment. The ECGs also comes under this this field. Okay. Next is respiratory therapy technology. They train professionals to care for patients who have trouble in breathing. At the last, we are going to discuss some key features which are given by Ministry of Health and Family Welfare. I think we all are paramedical professionals, so we all are having these qualities. First one is clinical care. Second is communication, membership of a multidisciplinary health team, then ethics and accountability, commitment to professional excellence, leadership and mentorship, and the last one is social accountability and responsibility, right? So that's all about for today's PPT. Thank you so much for listening my words so patiently and kindly. Thank you so much.
Thank you so much, ma'am, for your valuable information for the future of paramedical students. Thank you so much.
हाँ दिया,
मेरा क्वेश्चन है आपसे।
क्या?
हम पढ़ाई तो अच्छी कर ही लेते हैं, क्या हम एंकरिंग भी अच्छी कर रहे हैं?
तुम्हें अभी भी अपनी एंकरिंग पर विश्वास नहीं है? चलो हम अपनी डिग्निटीज से पूछते हैं कि उन्हें हमारी एंकरिंग कैसे लगी।
बहुत ही बढ़िया,
थैंक यू।
मन खुश हो गया थानू देख। ओके,
तुम समझ पाओगे हिंदी में? तुम पंजाबी समझती हो? मैं हिंदी में बोलूँगा एक वर्ड, अद्भुत।
थैंक यू सर।
थैंक यू सो मच सर। मैं पूछूं अब?
जरूर।
अब मैं नरिंदर सर से पूछना चाहूंगी, सर थानू साडी एंकरिंग कितना दी लगी? दसो सर।
बहुत बढ़िया प्रधान साहब।
थैंक यू सर।
फिर से पूछूं मैं?
पूछो।
अब हम अपने स्पीकर से पूछना चाहेंगे कि उन्हें हमारी होस्टिंग कैसी लगी।
I guess it's our privilege to have small girls, so innocent faces, so beautiful, very nice. Keep it up, guys. Proud of you.
It was awesome. Rise and shine.
Thank you, sir.
Thank you so much. लास्ट में ऑडियंस से कैसी लगी?
Thank you so much, everyone.
Thank you so much. Now, moving further, it's time to start our first competition, which is model presentation. So, I would like to call our first participant, student of Organised Institute of Paramedical and Allied Sciences, Roorkee, Uttarakhand.
Regards, I am Ujasvi from BMRIT first year batch 2021 to 24. I am going to represent our college, Organised Institute of Paramedical and Allied Sciences. Our college is running for 6 courses affiliated to HNB Gurdwal University.
Now I am going to explain the system. That very first is cardiovascular system. In a cardiovascular system, we have two terms. That very first is cardio, that is represent heart, and second is vascular, that is represent vessels. In our vessels, we have two vessels. That first is superior vena cava and second is inferior vena cava. Superior vena cava and inferior vena cava carry the oxygenated blood from lower body part and upper body part, enter to the right atrium and come to the right ventricle. Between the right atrium and right ventricle have a wall that is known as tricuspid wall. After that, have one more wall that is called pulmonary wall between the pulmonary artery and right ventricle. With the help of pulmonary artery, blood comes to the lungs for oxygenation. After the oxygenation, the blood with the help of pulmonary vein comes to the left atrium. Left ventricle. Between the left atrium and left ventricle have a wall that is also known as bicuspid wall and also known as mitral. Now have one more wall that is aortic wall between the left ventricle and aorta. After that, the all oxygenated blood go to the distribute in the all body part through the aorta.
Function is the filter to blood and create urine as a waste product. The organ of the urinary system including kidneys, ureter, urinary bladder and urethra. Nephron is the structure and function unit of urinary system. The kidney remove the waste and extra fluid from the blood and make the urine. It also regulates our blood pressure and blood volume and control the level of chemicals, electrolytes and salts and remove the toxic through the urine.
At the end, I would like to say I hope my model helps you to understand both the systems. Thank you so much for the cooperation.
Now, next model is from GNA University, Fagwara, Punjab. Next model is from GNA University, Fagwara, Punjab, X-ray machine. Now, the next model is from Sant Baba Park Singh University, Jalandhar, Punjab.
Good morning, everyone. My name is Ishita Jyoti, BSc Radiology Imaging Technology 4th semester from Sant Baba Park Singh University. Our model on the topic is an ultrasound. Ultrasound is an modality. Ultrasound imaging uses sound waves to produce pictures of the inside of the body. It helps to diagnose cause of pain, infection in internal organs of the body and to examine an unborn child, fetus in pregnant women. This is all about the ultrasound. Thank you so much.
Now, the next model is from our Nanak Paramedical College, Dhahan Kaleran.
Greetings of the day. My name is Devinderpreet Kaur. I am student of BSc Operation Theatre Technology, 2nd semester in Nanak Paramedical College, Dhahan Kaleran. The first anesthesia machine was invented by Edmund Gaskin Boyle in 1970. This is the model of anesthesia machine in front of you. Firstly, we are starting from main switch. This is the main switch of anesthesia machine. It is monitor. It is compact type of monitor. With the help of this monitor, we can check all vitals of the patient. The next is rotameter, which contain flow meter tubes specific for each gas and flow control knobs. As a safety measure, these flow control knobs are color coded. Black for air, blue for nitrous oxide and white for oxygen. We can adjust the pressure of gas by rotating these flow control knobs clockwise or anti-clockwise. The next is vaporizer. These two are vaporizer. First is sevoflurane, second is halothane. They are used to deliver the inhalation agents to the patient. The next is soda lime canister, which contains soda lime granules. They absorb carbon dioxide from expired gases and the same gases are reused by the patient. This is rebreathing bag. The next is oxygen flush. It is a bypass system which bypass the intermediate and low pressure system and the oxygen directly reached at machine's outlet. It delivers 35 liters of oxygen per minute at the pressure of 45 to 60 psi. These two are storage drawers for equipment. These are some instruments used during give the anesthesia to the patient. The first is anesthesia face mask. With the help of this anesthesia face mask, we give 100% oxygen to the patient before intubation or before laryngoscopy. The next is laryngoscope. With the help of this laryngoscope, we can visualize the epiglottis region and also lift up the epiglottis of the patient for the intubation. The next is endotracheal tube. It is directly introduced into the trachea of the patient. With the help of this endotracheal tube, we provide inhalation gases to the patient. The next is Megalis forceps. It is used for remove foreign bodies from the pharynx and also used for pharyngeal packing. The next is vials. These two are vials. First is propofol and second is succinyl choline chloride. This is a syringe. The last is Geddel's airway. The aim of this airway is to prevent tongue fall. It also helps to maintain or open patient's airway. So, this is all about anesthesia machine. Thank you.
Now, it's time to begin our second competition, which is e-poster presentation. So, I would like to call Aman Singh, Quantum University. Please come on the stage and present your e-poster.
A very good afternoon to all of you. Myself Aman Singh, I first in course BMRIT from Quantum University, Roorkee. Today I am present show my poster. My topic is preventive measure to avoid repeat radiography. That means repeat radiography. What is repeat radiography? Repeat radiography that means अगर किसी भी पेशेंट को हम बार बार अगर एक्सपोजर दे रहे हैं और उसका एक्सरे कर रहे हैं तो उसको अवॉइड कैसे कर सकते हैं, उसे हम रोक कैसे सकते हैं. द सब टॉपिक इज मेटालिक ऑब्जेक्ट. फर्स्ट ऑफ ऑल जब कोई भी पेशेंट आता है और वो मेटालिक ऑब्जेक्ट जैसे कि नेकलेस, ईयरिंग, कुछ भी अगर वो वियर किया रहता है, उसके बाद अगर टेक्नीशियन उस चीज़ को केयर नहीं करता है या तो उसे गाइड नहीं करता है और उसका अगर हम एक्सपोजर कर लेते हैं, इन द केस आफ्टर उसको हम उसका जो भी रिपोर्ट रहता है वो क्लियर नहीं होता है, उसमें डायग्नोस नहीं हो पाता है कि हमें क्या फाइंड आउट करना था. इसलिए पहले मेटालिक ऑब्जेक्ट जो होता है उसको रिमूव आउट करना रहता है कि हम पेशेंट का एक्सपोजर बार बार न करें. एंड सेकेंड सब टॉपिक इज पेशेंट कम्युनिकेशन. जो टेक्नीशियन रहता है और कोई पेशेंट रहता है, इन द केस अगर कोई छोटा बच्चा है उसका हम एक्सपोजर कर रहे हैं तो उस छोटे बच्चे को पहले हमको टेक्नीशियन और छोटे बच्चे में कम्युनिकेशन अच्छा रहना चाहिए कि उस बच्चे को हमें जो भी घबराहट हो रहा है या बच्चे से मशीन दे के घबरा जाते हैं तो पेशेंट का टेक्नीशियन का कम्युनिकेशन पेशेंट से इतना अच्छा होना चाहिए कि उसका जो भी घबराहट है वो कम हो सके और उससे कोई भी दिक्कत ना हो. रिड्यूस पेशेंट एनेक्सिटी, इंक्रीज पेशेंट कोऑपरेशन एंड मोस्ट इम्पोर्टेंटली रिड्यूस अननेसेसरी रिपीट. इसे भी हम बार बार अगर हम पेशेंट को गाइड कर देंगे, अगर पेशेंट को एक्सपोजर सही से दे देंगे तो हमें बार बार उसका हमको एक्सपोजर नहीं करना पड़ेगा, हमें उससे एक बार में एक्सपोजर बस देना पड़ेगा. एंड द लास्ट टॉपिक इज ऑप्टिमल रेडियोग्राफी टेक्निक. जो भी टेक्नीशियन होता है उसको स्किल होना चाहिए, उसको बहुत अच्छे से अगर हम पेशेंट का एक्सपोजर कर रहे हैं तो उसके बारे में उसे बहुत अच्छे से पता होना चाहिए कि हमें क्या, जैसे पेशेंट को पोजीशनिंग कर रहे हैं तो पेशेंट को हम अगर परफेक्ट पोजीशनिंग कर देंगे तो उसको हम बार बार हम एक्सपोजर नहीं ले पाएंगे. अगर एक बार हम पेशेंट का पोजीशनिंग अच्छे से कर दिए, उसे गाइड अच्छे से दे दिए तो हमें बार बार उसका एक्सपोजर नहीं करना पड़ेगा. और ओवरऑल कंक्लूजन ये मेरे टॉपिक का ये है कि हमें रिपीट रेडियोग्राफी जो बार बार होता है, क्योंकि जो एक्सरे होता है, जो रेडिएशन होता है, वो रेडिएशन भी बहुत हार्मफुल होता है। किसी भी पेशेंट के ऊपर रेडिएशन जो होता है बहुत हार्मफुल होता है। तो कंक्लूजन मेरा यही है कि हमें किसी भी पेशेंट का एक्सपोजर जो होता है उसे एक बार में ही कंप्लीट करना रहेगा। ओके, थैंक यू।
अमन,
Now, I would like to call
back to stage.
Yes, ma'am.
Aman, you have explained about patient communication related to the children's, right? So, do we need the patient good communication only for the children's, or it is for every patient?
नो मैम, एवरी पेशेंट फर्स्ट ऑफ ऑल जो एजुकेटेड है उन्हें तो हमें कोई भी गाइड नहीं करना पड़ेगा। जैसे कुछ अनएजुकेटेड हैं, यानी जो विलेज से आते हैं, जो गांव मतलब गांव से आते हैं, उतने एजुकेटेड नहीं है, तो उनको हमें थोड़ा गाइड करना पड़ेगा।
तो इट इज़ दिस कंपलसरी कि अगर पेशेंट एजुकेटेड होगा आप तभी उसको कम्युनिकेशन अच्छा रहेगा, अदरवाइज आप उसको कम्युनिकेशन नहीं करेंगे?
नहीं मैम, कुछ एजुकेटेड भी होते हैं जो इस चीज़ के बारे में बहुत अच्छे से जानते हैं, लेकिन फर्स्ट ऑफ ऑल जो टेक्नीशियन होता है इसका वही मतलब उसका पहला काम यही है कि चाहे वो एजुकेटेड हो या तो अनएजुकेटेड हो, सबको गाइड करना है।
एग्जैक्टली, ठीक है। इट्स आइदर अ चिल्ड्रन, ओल्ड एज, एनी ग्रुप ऑफ पेशेंट, we have to need a proper communication before the procedure, during the procedure, or after the procedure. Okay, very well, good, keep it up better. Very nice.
Thank you, Aman. Now, I would like to invite Amisha and Anshul, Sant Baba Park Singh University. Please come on the stage and present your e-poster. Please come on the stage.
Good afternoon to everyone. My name is Amisha. I am from Sant Baba Bhag Singh University, Jalandhar. My topic is on X-ray radiation. So X-ray is an electromagnetic radiations. X-ray जो होती है वो पेशेंट को
Relax, beta. Deep.
एक्सरे आप जानते हैं क्या? एक्सरे जो है वो जो बुजुर्ग लोग होते हैं उनमें जो कम डोज लगती है और जो यंगर होते हैं उनमें ज़्यादा लगती है। तो हमें जो यंगर पीपल होते हैं उनमें ज़्यादा केयर करने की ज़रूरत होती है एज कम्पेरिजन टू ओल्डर वन। और एक्सरे डोजेज हमें जो है वो कम से कम रेडिएशन डोज पेशेंट को देनी चाहिए पिक्चर को जनरेट करने के लिए, और हमें बार बार पेशेंट को एक्सपोजर नहीं देना चाहिए। एक बार पेशेंट को एक्सपोजर देने के बाद 3 मंथ तक जब तक जरूरत ना पड़े तो कोई भी एक्सपोजर नहीं देना चाहिए। और हमारे जो इक्विपमेंट्स होते हैं वो हमें जनरली डे टू डे पे चेक करने चाहिए, और जब भी हम कोई एक्सरे करते हैं उस टाइम पे हमें पेशेंट को अकेला नहीं छोड़ना चाहिए, और हमें पेशेंट को उसके बारे में बताना चाहिए। और अगर हम कोई भी
Thank you so much. Now next is Atul Kathuria's e-poster from SGT University. But he is absent. Now I would like to invite Janvi Niga, Guru Nanak Paramedical College, Dhahan Kaleran. Please come on the stage.
Pathophysiology of the diabetes mellitus, which was published in 2004. Thank you.
Thank you, Janvi Niga. Now, next is Sana Mirza's e-poster from Santosh Medical College. Please come on the stage.
Good evening, everyone presented here. This is Sana Ali Mirza, and I am from Santosh Medical College. So today I am here to represent my poster, and my topic is high intensity focused ultrasound. So basically, it is an advancement of ultrasound. Okay. So firstly, I will introduce this. हाई इंटेंसिटी फोकस अल्ट्रासाउंड एक मिनिमली इन्वेसिव टेक्निक है. इसका मतलब ये है कि इसमें आप किसी चीज़ को, किसी बॉडी पार्ट को बिना पंचर किए हुए आप ट्यूमर को रिमूव कर सकते हो. ठीक है. इसका मैकेनिज्म ये होता है कि आप एक हाई फ्रीक्वेंसी प्रोब को यूज़ करते हैं जिससे आप उस
Sana. Sana. Very nicely presented by you. This is high intensity focus ultrasound. There is my a little bit question. You have not mentioned how much frequency you will use. Can you describe it?
Yeah, we will use a frequency above 20 megahertz or more than that diagnostic range, so that temperature will be lethal, and at that point when our piezoelectric crystals start vibrating more.
So it means there will be used the heating effect of ultrasonic range for as a lethal dose. So it will be near about 20 kilohertz to 20 megahertz. Am I right? Thank you so much. Very nicely presented.
Thank you so much. Now, I would like to call Soptic Pain, Government Medical College and Hospital, Chandigarh. Please come on the stage.
Good afternoon, everyone. First of all, I would like to thank you all of you for giving me the opportunity to my post presentation of the proton counting detector city. So, what is the proton counting detector city? The main concept of the proton counting detector city is that we are counting the each and individual photons, and we convert the X-ray energy directly into the electrical signal. So, before going to the main topic, I will talk about the basic concept of the CT scan. As we all know, the basic concept of the CT scan is the different structure of an object can be reconstructed from the multiple projection. So, the CT detector can capture the X-ray energy from the patient and transform into electrical signal. After we getting the signal is sent to the analog digital converter. After that, the analog digital converter, we are using the various type of the reconstruction algorithm. After that, we are taking the digital data into EAC, the digital analog converter. After that, we get the final image. So when we have the good minimum requirement of the CT detector, the CT detector should have the high efficiency and the fast response time, and should have the dynamic ranges. So nowadays we are using two types of CT detector technology. One is the ionization and gas chamber. It's mainly used in the single slice machine. When we come with the HDCT, the multiple detector CT, we are using the scintillation type of detector. So here, as we know, the scintillation type of detector mainly the work on the principle of the electron integrating detector. So in conventional energy integrating detector, we have two steps. First of all, the X-ray energy converted into light photon, and the light photon then converted into electrical signal. So if we want to the light photon to the detector should have the sector to reflect the X-ray from light photon to the photodiode to emit the electrical signal. And this is the main drawback of the energy integrating detector. As we increase the size of the detector, we are increasing the number of detector sector. That's why we are shorten the resolution. So here we come the photon counting detector. So in photon counting has so drawbacks. So there has the charge pile up and test space, process. So these drawbacks, these limited after the limitation, we can say that PCDCT has the emerging CT technology in modern CT detector technology. So it increased the spatial resolution, it increased the SNR value, it increased the CNR value. And it reduction the beam hardening artifact. As we know, the basic between the beam hardening artifact is that the poly energy source of the beam of the CT scan. That's why the beam hardening artifact, we can reduce the metal artifact in photon counting detector. That's all for me.
Now I would like to call Urvashi Chauhan, Quantum University. Please come on the stage.
Good evening, one and all present here. My name is Urvashi Chauhan from Quantum University.
अरे तो आने दे, ये वाली नहीं है, पीपीटी ये थोड़ी है हमारा. इनका ये दूसरे का है, इनका भी बैठे हैं ये, तो इनका बुला लें, इनका जिनका है ये वाला होगा, इनको बुला दें. अच्छा इनका बस नाम चेंज होगा मेरे को लग रहा है. Bachcho, is it not your PPT? I think this is your PPT?
Yes, sir.
This is right one, na? This PPT is right one? Yeah, because, okay. Urvashi Chauhan. Okay.
Good afternoon, everyone. My name is Mansi Gupta from Quantum University.
My name is Arti Kashyap from Quantum University. My name is Simran from Quantum University. Today we are here to present e-poster on the topic of CT enterprises. CT enterprises is a non-invasive technique to use visualization of small bowel disease, जिसमें हम longitudinal tube को insert करते हैं और contrast देते हैं for visualization of small bowel disease. These are the indications of CT enterprises. First is for the investigation of small bowel obstruction. There is an obstruction in the bowel. Crohn's disease. It is an inflammation in the bowel and intestinal bleeding and also for human condition.
Contraindications of CT enteroclysis, first one is pregnancy and allergic contrast media. Second one is intestinal fistula, and third one is biopsy and recent abdominal surgeries. Thank you.
May I
These,
ask one question?
1 minute, sir. These are the source of pictures, CT enteroclysis.
Okay, very nicely you shown the picture, CT enteroclysis. There is one question, which type of contrast you will use?
Ionized.
Ionized contrast medium?
Yes, sir.
Which contrast?
IOXL.
We cannot use a non-ionized?
Sorry, sir, confused this time.
Very right. Thank you.
Thank you, sir.
Thank you all. Now, I would like to invite Muskan Deep Kaur, GNS University, Phagwara. Please come on the stage. Muskan Deep Kaur. She is absent. Muskan Deep Kaur, please come on the stage.
Hello everyone, my name is Muskan Kaur, student of GNA University Phagwara from the Department of Medical Radiology and Imaging Technology. This is my poster. The first part of the poster tells us about the types of radiation and the barriers that can stop these radiation. First is the alpha radiation. Alpha radiation can be stopped by using a thin paper plate. Next one is beta radiation. Beta radiation can be stopped by using thin aluminium. X-rays and gamma radiation can be stopped by using thick lead plate. The next one is neutron radiation. Neutron radiation can be stopped by using water. The other part of the poster tells us about the basic radiation symbols. First symbol is the cogitary radiation area. This means that this area contains the radiation and the radiation modalities. The next symbols tell us about the authorized persons are only allowed in the radiation area because these radiation are very harmful for human body and can cause various effects. We should obey all the cogitary signs. They mean what they say. And for protecting of ourselves, we should wear all the lead equipments like lead apron, lead gloves and etc. Thank you.
So that's all about the e-poster competition. अर्ज किया है, कानों में खनकती है खूबसूरत बालियां, कानों में खनकती है खूबसूरत बालियां और मज़ा तब आता है जब महफिल में बजती हैं जोरदार तालियां.
जब तक हमारा रिज़ल्ट प्रिपेयर हो रहा है तब तक हम आपको शायरी सुनाते हैं. सुनोगे आप शायरी? कोई बात नहीं, मैं फिर भी सुनाऊंगी. ये शायरी मैं डेडिकेट करना चाहूँगी हमारे प्रिय अध्यापक मिस्टर मुदासिर मोहिउद्दीन. अर्ज किया है, जीवन की हर मुश्किल में समाधान दिखाते हैं आप, जीवन की हर मुश्किल में समाधान दिखाते हैं आप, नहीं सूझता जब कुछ तब याद आते हैं आप, धन्य हो गया जीवन मेरा, बन गए मेरे गुरु जो आप. So a huge round of applause for our teacher, Mr. Mudassir Mohiuddin.
आप में से कोई स्टेज पर आना चाहेगा? शायरी सुनाने के लिए।
गाना भी सुना सकते हो। नहीं, हम नाम नहीं लेंगे, आप जिसे आना है यहाँ से आ जाओ ऐसे। कोई नहीं आना चाहेगा? Give a huge round of applause for Gopal Singh.
आदरणीय अतिथिगण को मेरा प्रणाम, गुरुजनों को मेरा प्रणाम, सहपाठियों को। आप सबके सामने एक छोटी सी डॉक्टर कुमार विश्वास की कविता है कि कोई दीवाना कहता है, चंद लाइनें उसकी। तो अगर कुछ त्रुटियां हो तो माफ़ करना। कि कोई दीवाना कहता है, कोई पागल समझता है, मगर धरती की बेचैनी को बस बादल समझता है। मैं तुझसे दूर कैसा हूँ, तू मुझसे दूर कैसी है, ये तेरा दिल समझता है या मेरा दिल समझता है। ये जितने लोगों की आवाज़ है वो सारे के सारे दिल जले बैठे हैं यहाँ पर। कि जब दिल जले जब आपस में बैठ जाते तो कहते हैं कि मोहब्बत एक एहसासों की पावन सी कहानी है। कहीं कबीरा दीवाना था, कहीं मीरा दीवानी है। यहाँ सब लोग कहते हैं मेरी आंखों में आंसू है। जो तू समझे तो मोती है, जो ना समझे तो पानी है। जो तू समझे तो मोती है, जो ना समझे तो पानी है। बदलने को तो इन आँखों के मंजर कम नहीं बदले, तुम्हारी याद के मौसम हमारे गम नहीं बदले। तुम अगले जन्म में हमसे मिलोगी तब ये मानोगी, जमाने और सदी के इस बदल में हम नहीं बदले। कोई दीवाना कहता है, कोई पागल समझता है। हमें मालूम है दो दिल जुदाई सह नहीं सकते, मगर रस में वफा के ये कभी ये कह नहीं सकते। जरा कुछ देर तुम उन सहलों को चीख सुन भर लो, जो लहरों में डूबे हैं मगर सह नहीं सकते। जो लहरों में डूबे हैं मगर सह नहीं सकते। एक कुमार विश्वास की छोटी सी है कि जब लोग एक दूसरे से बिछड़ जाते हैं तो एक छोटी सी लाइन है कि अधूरी जवानी का क्या फायदा, बिन कथानक कहानी का क्या फायदा। जिस धूल कर नजर भी न पावन बने, आंखें में ऐसे पानी का क्या फायदा। नमस्कार आप सभी लोगों का धन्यवाद सहे दिल से।
हमारे पास एक सस्पेंस है आपके लिए। अब आपके सामने बहुत ही उम्दा सिंगर आ रहे हैं, तो गिव अ ह्यूज राउंड ऑफ अप्लॉज फॉर आवर मेंटर मिस्टर राजदीप सर।
दिया तुमने क्या बोला अभी? सिंगर? आई एम अ टीचर, नॉट अ सिंगर, पार्ट टाइम सिंगर। और अभी एक बच्चा था, वो कुमार विश्वास जी का बड़ा भक्त थे तुम, फैन थे? नहीं, इंसान है। आप भक्त थे या फैन थे? बहुत अच्छा गा रहे थे तुम। भक्त, ठीक है, मतलब बहरहाल जो भी है बड़ा अच्छा था। मैं भी, जो तुम हो वही मैं हूं। और कुमार विश्वास जिन्होंने हिंदी की कविता को देश के हर कोने तक पहुंचाया, हिंदी को कविता, जो हिंदी कविता के जो पुराने पूर्वज हुआ करते थे, कभी आपने नाम सुना हो रामधारी सिंह दिनकर, उनकी कविताएं, उनकी मुक्तक जो हुआ करते थे, वो सब चीज़ कहीं खो गई थी। कुमार विश्वास ने उनको फिर से जगाया, और मैं भी कोशिश करूंगा कि आप लोग वहीं पहुंचें जहां मैं आपको पहुंचाना चाहता हूं। ये बड़ा फेवरेट सा डायलॉग है, तो कुमार विश्वास का ही है। सब अपने दिल के राजा हैं, दाद दो, खाज मत दो। सब अपने दिल के राजा हैं, अब लगेगा, सबकी कोई रानी है। यहां सबने बोला, सब अपने दिल के राजा हैं, सबकी कोई रानी है। भले प्रकाशित हो ना हो पर सबकी कोई कहानी है। बड़ा सरल है पता लगाना किसने कितना दर्द सहा। अब लगेगा, बड़ा सरल है पता लगाना किसने कितना दर्द सहा। जिसकी जितनी आंख हंसे है उतनी पीर पुरानी है। बस्ती बस्ती घोर उदासी, पर्वत पर्वत खालीपन। मन हीरा बेमोल लुट गया, घिस घिस रीता तन चंदन। इस धरती से उस अंबर तक दो ही चीज गजब की हैं। एक तो तेरा भोलापन है, एक मेरा दीवानापन। उम्दा बोलो, उम्दा। अच्छा, एक और सेंटर पे लेके। एक बार जर्मनी में ना एक सम्मेलन हुआ था, कॉन्फ्रेंस। एक बार जर्मनी में एक सम्मेलन हुआ, वहाँ रूस और अमेरिका के राष्ट्रपति आए थे, लेकिन इंडिया से केवल हम बुलाए थे। चर्चा जानवरों के प्रशिक्षण पर चली, द टर्म ट्रेनिंग ऑफ एनिमल्स। चर्चा जानवरों के प्रशिक्षण पर चली, तो अमेरिका के राष्ट्रपति बोले, भाई हमारे यहाँ जानवरों को ऐसी ट्रेनिंग दी जाती है कि लोमड़ी हवाई जहाज चलाती है। ये सुन के रूस के राष्ट्रपति उछल पड़े, बोले बस हमारे यहाँ तो लंगूर फायरिंग करते और बंदर गोला बारूद भरते। अब हमारी बारी आई, थोड़ी सी उदासी छाई, चुप कैसे रहते। भारत की इज्जत का सवाल था, पर जनाब हमारा उत्तर भी बेमिसाल था। हमने कहा जी छोड़िए, आपके जानवर तो इसी लायक हैं, कभी हमारे इंडिया आइए, हमारे यहाँ तो गधे विधायक हैं। अब इसको प्लीज़ अदरवाइज ना लें, जिस किसी के भी कुछ बाकी मैं कुछ कहूँगा नहीं। और चलते चलते एक चीज़, दिस इज़ अ मैसेज and this is my favorite one, the 4 lines for you. हंसने का नहीं, हमसे मत पूछिए हम किधर जाएंगे, हमसे मत पूछिए हम किधर जाएंगे, थक गए हैं बहुत अपने घर जाएंगे, थक गए हैं बहुत अपने घर जाएंगे, शीश महलों में हमें न ले जाइए, आईने देख लेंगे तो डर जाएंगे, शीश महलों में हमें न ले जाइए, आईने देख लेंगे तो डर जाएंगे, मौत के गम से आप नाहक परेशान हैं। सर आपके लिए, मौत के गम से आप नाहक परेशान हैं, अरे आप जिंदा कहाँ हैं जो मर जाएंगे। हम सब यहाँ बैठे हैं, हमारा तो घर है, जरा सोचो जिनका घर नहीं है वो किधर जाएंगे, जिनका घर नहीं है वो किधर जाएंगे। जल्दी रिजल्ट बनाओ, खत्म हो गया, हो गया। Thank you so much. So now is the time to announce the result, which activities performed by all students, and it was very great day. I have spent with all of you. So I will start from the result of a dance category, where two universities are participated in a dance form. One is GNA University Fagwada, and one is Guru Nanak Paramedical College, Dhahan Kaleran, Shahid Bhagat Singh Nagar. So any idea? Result मुझसे बेहतर ऑडियंस को पता होगा, मैं क्योंकि I was audience at that time. So any idea which will be winner? Who will be winner? GNA, Guru Nanak. So before I announce the result, I would like to call our respected secretary sir on the dais, our convener of this program, Barar sir, our medical superintendent, Dr. Ravinder Khajuria, our consultant anesthesiologist, Dr. Deepak Duggal. Please. Now it's the time to announce the dance winner, that is Guru Nanak Paramedical College, Dhahan Kaleran, Shahid Bhagat Singh Nagar.
Congratulations and celebrations when I tell everyone that you're
तालियां खामोश ना रहें, बजती रहें।
and jubilations. I want the world to know I'm happy as can be. Who would believe that I could be happy and contented? I used to think that happiness hadn't been invented, but that was in the bad old days before I met you. When I let you walk into my heart.
तालियों का शोर कायम रहेगा। बता दो हम हैं। मैं आभार व्यक्त करता हूँ अपने सभी जजेस का, जिन्होंने बड़ा कठिन होता है किसी को जज करना जब बहुत सारी परफॉर्मेंसेस आउटस्टैंडिंग हो। यहाँ ऐसा कोई जजमेंटल नहीं है। विद्यार्थी स्टूडेंट्स सारे बहुत मेहनत करते हैं, बहुत सारे प्रयासों के साथ अपने मॉडल्स को, अपने प्रोजेक्ट्स को प्रदर्शित करते हैं। उसके पीछे उनकी बहुत सारी मेहनत, उनकी लगन होती है। तो इट्स नॉट द टाइम ऑफ जजमेंट, बट हर काम के पीछे हर मैं अभी पीछे प्रॉब्लम से जाकर पूछ रहा था, मैं प्लीज़ रिजल्ट को ना दोबारा रिकन्सिडर कर लो, मुझे लगता है कहीं गड़बड़ है। हमने भी चेक किया, क्योंकि पोस्टर मॉडल प्रेजेंटेशन अगेन गोज टू गुरु नानक पैरामेडिकल कॉलेज। जैसा हमने आज अपना वक्त बिताया फर्स्ट नेशनल पैरामेडिकल मीट के लिए, मिलना और इस आपस के जान पहचान और मिलने के इस ड्रीम को, इस सपने को साकार करने में गुरु नानक पैरामेडिकल कॉलेज के स्टूडेंट्स, उनका बड़ा योगदान रहा, जिन्होंने अपनी दिन रात मेहनत की ताकि वो अपने आप को और आप सबको उतना सम्मान दे सकें, उतना आतिथ्य दे सकें जो आप सब डिजर्व करते हैं। अतिथि देवो भव, उस परंपरा को आगे बढ़ाने के लिए, उस परंपरा को साकार करने के लिए बहुत मेहनत की हमारे गुरु नानक पैरामेडिकल कॉलेज के स्टूडेंट्स ने। सो दिस इज द टाइम टू facilitate all the students of Guru Nanak Paramedical College. So first I would like to call Miss Ishan Preet Kaur. मिस दिया, मिस कोमल, मिस इर्तिजा, मिस इंदरप्रीत कौर, Siddharth is here. Miss Neha. Miss Lovepreet Kaur. Miss Janvi. Miss Muskan. Miss Himani Sharma. Miss Davinder Kaur. And Miss Sanjana. Thank you so much, sir. Thank you so much. Kindly take your seats, please. Now, I would like to call again Miss Dia and Miss Komal. Now, once again, now I would like to call all the participants, dance participants from the GNA University on the dais. Please come on the dais. All the dance participants from GNA University. Dr. Deepak sir and Medical Superintendent sir, kindly join us, please. GNA यूनिवर्सिटी के शानदार स्टूडेंट्स के लिए जानदार तालियां। बहुत अच्छा डांस था आपका भी। पर डांस के टाइम तो 5 थे तुम, डांस के टाइम तो 6 थे। आशीर्वाद देते फ्रॉम गुरु नानक पैरामेडिकल कॉलेज। एंड वन मोर, हमने जो स्किट देखा, हमारे सामने जो लोग प्रेजेंट होते हैं हम उनकी इस कला और उनकी प्रतिभा को देखते हैं, लेकिन उस कला और प्रतिभा के पीछे एक संघर्ष, उसके पीछे एक लगन, उनको क्रिएटिविटी, उनको तैयार करना, उनको वैसा बनाना कि वो आपके सामने एक बेहतर प्रदर्शन, बेहतर परफॉर्मेंस दे सकें। आज जो मैंने स्किट देखा, नो डाउट जजेस ने भी उसको बहुत अच्छे रिमार्क्स दिए, आउटस्टैंडिंग परफॉर्मेंस थी, लेकिन उस परफॉर्मेंस को उतनी परफॉर्मेंस लाइव बनाने के लिए हमारे एक मेकअप आर्टिस्ट का बहुत बड़ा कमाल था। विदाउट दैट मेकअप आर्टिस्ट दैट एक्ट वाज नॉट पॉसिबल। सो आई वुड लाइक टू कॉल मिस शिवाली फ्रॉम संत बाबा भाग सिंह यूनिवर्सिटी एज अ मेकअप आर्टिस्ट। Thank you so much, sir. I'm going to hand over mic Miss Dia and Miss Komal.
Now, I would like to inform all the students coming from different colleges, universities and institutions that your certificates will be handed to your faculty members so you can collect from them. आप में से कोई और स्टेज पर आना चाहेगा? कोई आना चाहेगा? Come on guys, show your talent. Anyone? Now, we would like to call our mentor, Mr. Rajdeep Vidwan. उससे पहले एक शायरी सर के लिए। ये हुनर ये सादगी, ये हुनर ये सादगी, ये अपनेपन की मूरत नहीं देखी। ये हुनर ये सादगी, ये अपनेपन की मूरत नहीं देखी। किरदार तो बहुत देखे हैं ज़माने में, किरदार तो बहुत देखे हैं ज़माने में, मगर आप जैसी शख्सियत नहीं देखी, मगर आप जैसी शख्सियत नहीं देखी। So please welcome our mentor, Mr. Rajdeep Vidwan.
आभार। मुझे बुलाया गया है वोट ऑफ थैंक्स के लिए, और मैंने अपना आज का अनुभव शेयर करूंगा। उससे पहले मैं सबसे पहले आभार व्यक्त करता हूं अपने सभी गेस्ट स्पीकर्स का, डॉक्टर सौरभ सर, डॉक्टर विकास सर, डॉक्टर जयश्री मैम, मिस्टर वाजी, भावना मैम, पीयूषी मैम, आप सब ने अपने बड़े व्यस्ततम बिजी शेड्यूल से हमारे लिए समय निकाला, उसके लिए मैं बहुत बहुत आभार व्यक्त करता हूँ। On the behalf of Guru Nanak Medical and Educational Trust, on behalf of our Honorable President, on behalf of our Honorable Secretary Sir, और entire management, मैं आभार व्यक्त करता हूँ आप सभी विद्यार्थियों का, आप सभी स्टूडेंट्स का जो पैरामेडिक्स में हैं और जो हमारे देश के कोने कोने से यहाँ पर आए। अभी मुझे आभास है इस बात का, क्योंकि मैं रात को करीब 12 बजे तक, 1 बजे तक, इवन मोर देन रात के 1 बजे तक आप लोग ट्रैवल करके 4-4, 6-6, 12-12 घंटे का ट्रैवल करके आप लोग एक दिन की मीट के लिए यहाँ पर आए। It shows how you are enthusiastic. It shows how you are dedicated. It shows how you are special for us. शब्द कम हो सकते हैं कि मैं अपनी भावनाओं को व्यक्त करूं कि आज का दिन मेरे लिए बहुत खास है, क्योंकि हमने एक शुरुआत की है नेशनल पैरामेडिक मीट की, जिसका आज पहला संस्करण, फर्स्ट पैरामेडिक मीट थी। आशा करता हूँ हम आगे भी इस तरीके के इवेंट्स को करते रहेंगे और कोशिश करेंगे, जैसा हमारे कन्वीनर सर मिस्टर बरार सर ने कहा था कि मॉर्निंग में कि कोशिश करेंगे कि इस बार हमने आपसे फी ली है, अगली बार से कोशिश करेंगे कि हम आपको इससे अच्छी हॉस्पिटलिटी दें विदाउट एनी फी। हम इस बार एकोमोडेशन प्रोवाइड नहीं कर पाए, हम कोशिश करेंगे कि नेक्स्ट ईयर से हम इसको और बेहतर बनाने की कोशिश करें। ये मेरे विचार हैं, मेरा आभार है आप सबके प्रति, और मैं गुरु नानक पैरामेडिकल कॉलेज और गुरु नानक मेडिकल एंड एजुकेशनल ट्रस्ट की तरफ से सहृदय आपका धन्यवाद करता हूँ। और मैं भी जानना चाहता हूँ कि आपका दिन कैसा गुजरा। बोथ एंजॉय सर जाने दो, थक गए हैं, घर जाएंगे। The lot of students are coming from different states. They want to visit Punjab. Punjab is a very beautiful state. Punjab is the state of culture. Punjab is the state of hospitality. Punjab is the state of मानवीयता, आत्मीयता, और अपनेपन का सबसे ज़्यादा एहसास देने वाला अगर कोई स्टेट है वो है पंजाब। तो आप घूमिए पंजाब, अगली बार हम आपको मौका देंगे कि आप पंजाब घूमें। मेरी शुभकामनाएं आप सबके साथ, बहुत बहुत धन्यवाद। नाउ इज द टाइम टू रॉक, सो एंजॉय अस ऑन डीजे। थैंक यू सो मच, थैंक यू सो मच सर। मैं बहुत बहुत आभारी हूँ सेक्रेटरी सर का, प्रेसिडेंट सर का। बिना उनके विश्वास और उनके आशीर्वाद के ये सब संभव नहीं था। बहुत बहुत धन्यवाद सर, थैंक यू सो मच सर, थैंक यू। announcement to all of you. The conference, the meet certificate, you can collect from your teachers. The students who came along with the teachers, they can collect their certificates from their teachers. And the students or professionals who came alone, they can collect the certificates from Mr. Sukhbir Lal, who's the behind the stage, is our coordinator, sir. So individuals can collect from there. Thank you so much.
इस दिन के आखिर में मेरी तरफ से आखिरी शायरी। उजाले अपनी यादों के हमारे साथ रहने दो, उजाले अपनी यादों के हमारे साथ रहने दो, फिर दूर तलक रात ही रात होगी। मुसाफिर हो तुम भी, मुसाफिर हैं हम भी, मुसाफिर हो तुम भी, मुसाफिर हैं हम भी, किसी ना किसी मोड़ पर मुलाकात तो जरूर होगी। Now, it's time to lose your energy with DJ.
मेरे पूर्ण करियो काज, गुरु गुंगे गुरु बावरे, गुरु गुंगे गुरु बावरे, गुरा के रहिए दास, जे गुर भेजे नरक नू, मत स्वर्ग की रखिए आस। सदा भवानी दागिनी, सदा भवानी, सदा भवानी दागिनी, सदा